The Association of Community Pharmacists of Nigeria, ACPN, Lagos State presents Continuing Education Conference 2026. Theme: Advancing Community Pharmacy Practice through Technology, Collaboration, and Expanded Services. Special guests of honor: Pharmacist Ayuba Tanko Ibrahim, FPSN, MIAD, MBA, President, Pharmaceutical Society of Nigeria, PSN. Guest of honor: Pharmacist Ibrahim Babashiu Ahmed, FPSN, FPC Farm, Registrar, Pharmacy Council of Nigeria. Professor Moji Adeyeye, Director General, NAFDAC. Dr. Mrs. Kemi Uyemi, Special Advisor to the Governor. Pharmacist Olumide Akitayo, FPSN, Guest of honor. Chairman, Opening Ceremony, Pharmacist Sir Ike Onyechi, FPSN, CEO Alpha Pharmacy, Chairman of Occasion Day 1. Chairman, Day 2 CEC 2026, Pharmacist Sheye Agbola, CEO Docmark Ventures Limited. Chief Host, Pharmacist Eze Igwekamma, National Chairman, Association of Community Pharmacists of Nigeria, ACPN. Keynote Speaker, Dr. Njide Ndili, Country Director, Farm Access. Workshop Facilitators, Dr. Margaret Ilomaya, Pharmacist Samson Omata. Panelists, Pharmacist Wale Oladibulu, FPSN, Immediate Past National Chairman, ACPN. Pharmacist Mrs. Folashade Lawal, FPSN, CEO Victory Drugs, Festac. Pharmacist Ike Ugu, FPSN, Pharmacare Group, Festac Lagos. Pharmacist Ochuko Omaraye, FPSN, CEO New Heart Pharmaceuticals Limited, Ilupeju, Lagos. Co-host, Pharmacist Chief Olaiton Ogunlade, FPSN, Chairman, PSN Lagos State Branch. Host, Pharmacist Tolulope Ajayi, Chairman, ACPN Lagos State Branch. Date: March 24 to 26, 2026. Venue: 10 Degrees Event Center, Oregun, Ikeja. Time: 8 a.m. This hybrid event will be streamed live on PharmaStreamTV YouTube channel. Subscribe today to get instant live notifications when event goes live. Announcer: Pharmacist Evelyn O. Brambifa, Chairman, CEC Planning Committee.
Anthem. Let's rise, please. We started with God. Yes, it's a professional conference, but I believe that most, if not all of us, believe in God. We believe that He's a major part of the success we've experienced this year. We can't do without Him. And so we're going to be taking
we hail thee, our own dear native land, though tribes of the differ in brotherhood. Proud to serve a sovereign motherland.
Our nation will grow. Our nation will flourish. And I'm excited to be part of this nation and to be part of this noble profession, which is one area that actually we can impact the nation positively. I pray that our prayers would be fulfilled. In Jesus' name. Thank you very much for being part of it. My name is Laiton Olaleye. I'm one of us as men of honor. All right, so our MCs that we've seen in the last 2 days, somehow one of them will still be coming, and so I'm actually standing in for them. And so we're going right into the program this morning. Please, I'd like you to still send messages to your colleagues in your zones, your friends, to join the third day. We started so well. Day 1 was beautiful. Day 2 was fantastic. And we can assure you that today, even though it may not be as long as the other day, is very jam-packed with beautiful things. We still have product presentations. We have one master class. And of course, we'll still have our AGM, the time for us to actually have feedbacks from our leaders and also still share with them. And so we're going to be going into the third day with the opening remark by our state chairman, who has worked so hard to make sure, yes, he has worked so hard. Let's appreciate him. Yes, to make sure that this conference, is a notch beyond what we've had in the previous years. Is no one else but our own pharmacist, Tolulope Ajayi. Please let's give him a round of applause as he comes up to take the microphone.
Thank you very much, Pharmacist Olaiton. We appreciate you for the great work we're doing. Good morning, dear colleagues. Humble you saying that, but the truth is, we all made it happen. We all made it happen. When we choose leaders, leaders are the faces that we see for the aggregation of what each and every one of us do together. So I think we should all appreciate ourselves for what we can all see in CEC 2026. Please, let's jam those hands together for ourselves. Jam it together for Acpn Lagos. And like we told ourselves the other day, the truth is we can do all things. We can make anything happen. All we need to do is to unite. All we need to do is to imagine it. All we need to do is to be determined to make it happen. We want to give God all the glory that we've not had a better last year in CEC. Last year was better than the previous year, and we can all also testify that 2026 is better than 2025. And when you also do so well, it puts you under a greater charge to do more, so that 2027 would also be better than 2026. So I want to congratulate each and every one of us that has played our part so well to make 2026 CEC a success. Day 1 was wonderful. Day 2 was great. And today, by the special grace of God, will be an icing on the cake. Thanks to the planning committee, all the members, ably led by our amiable pharmacist, Dr. Evelyn Brambaifa, and each and every member of that team. They've been so wonderful. Many of their meetings stretched into the far wee hours of the night, and they did so wonderfully well. To all our zonal leaders, all our zonal coordinators, we appreciate you. Leadership comes at a cost. Leadership comes at a price. It's not like the conventional way that people think once you're in an office is to enjoy and to, attract things, benefits to yourself. It's a price. And I'm happy at the crop of zonal leaders that we have who are making things happen, providing credible leadership in all the zones that we have across the state. Congratulations to us and thanks for all that we do. As we go into the third day, of course, we have a few sessions. We plan to have a session with PCN. But interestingly, they also have another program clashing with ours this week. Most of their key officers are currently in Abuja with the registrar. But we are trying to work out an arrangement for him to connect virtually so that we still have a good session. We still have a couple of presentations, master classes that we would, still further impart and benefit from before we leave here today. And then we'll cap the entire program with our AGM AGM, which is the most important meeting for us as an association. I want to encourage everyone, let's be very attentive, let's be very engaging, let's connect. There are so many faces you're seeing here today that you may not be able to easily see like that unless you travel from one end of Badagry to the other end of Acpn before you can see them. So let's take advantage of the fact that we're all here. Let's connect, let's unite, let's bond. And when we get to the AGM session, let's all participate. It's our meeting, it's not their meeting. Let's all brainstorm and think of how our profession will get better, how the association will work stronger, and then we'll keep reaching for greater heights. Pharmacists are frontline people. Pharmacists are pace setters in the healthcare delivery system, and I want all of us to please keep thinking. Let's keep asking ourselves, what are the things that we need to do to ensure that we occupy our rightful place where we belong as frontliners in the healthcare delivery system. We must be proud of who we are, and we must continue to innovate. We must continue to develop. We must continue to unite. We have bigger things that unite us than the petty things that divide us. We must connect. We must unite. We must bond. We must form a formidable team that can influence things in the healthcare delivery system. Together, I believe we can do it, and I believe that as we move on from here, we'll be reaching for greater heights. On this note, I want to welcome everyone to Day 3 of CEC 2026 and our AGM. I wish us a very, very wonderful time. Thank you, thank you, thank you.
Please, another round of applause for our able chairman. Let's give it up to him. Please, let's put our hands together for him. Thank you so much, Pharmacist Tolu Ajayi. We appreciate your leadership. Right about now, we're going to be having the first product presentation for the day, which will be taken by Pharmacy Plus, the Reload people, and of course, you know, they have other ranges of products now. But before they come up, yesterday we had the preliminary session for our zonal dynamics. If you're zone 1, can you just wave? Your zone qualified for today. Where are they? I can't see so many hands. All right, so we had, of all the zones that presented yesterday, only 4 zones qualified to present the work they've done in the last 1 year to the house this year at this year's conference. And these 4 zones, I know they were announced yesterday, but some of us probably had left. So we had Amen Zone. Yeah, if you're in the house, clap. Amen Zone. You can clap, you can clap, you can shout, do whatever. Amen Zone. Ejigbo Zone. All right. Acot Zone. An Idea Zone. All right. So you'll be coming up shortly. Please prepare. But as of now, we have only 2 presentations from Ejigbo and Idea Zone. Make sure, so Acot Zone and Amen Zone, please get your slides to us immediately. Get your slides to us, because if it is your time and you're not available, we mean your slide presentation, ensure that the media has it right away. So, Pharmacy Plus, please come up for your presentation. 10 minutes. Thank you.
Good morning, everyone. I'm Augustina Renewal from Pharmacy Plus. I'm here to talk to us today about something that people are not talking about, but a lot of women are experiencing now. So the title of my presentation is Aging Gracefully. As a woman, what do we look forward to? The journey through life for women are actually quite beautiful. When we go through the stage of growing up, childbearing, we do the whole girly phase, get married, childbearing. So the question is, what do we look forward to when we are aging? A lot of time, our focuses are actually in the beautiful pictures. But the truth of the matter is that as our age is advancing, a lot of things in our bodies are also advancing, including our hormones. So are we having joys and excitements or worries and uncertainties? One of the inevitable occurrences in life, just like aging, we cannot hold aging, we must age. And that is how it is for menopause. We cannot We cannot stop the process. Whether we like it or not, menopause will come to play. Like I tell people, just from the day we start, a girl child is born, the body is already preparing for menstruation. And from the day we begin menstruation, our body is already preparing for menopause. So what exactly is menopause? Menopause is a natural process of aging. Natural. It's not something we can stop. It's not something we can change. Even if we use all the Botox in the world, we are just focused on the physical appearance. But this thing called menopause is something that is inevitable and must happen to us. It is a stage in a woman's life when the ovaries completely stop producing reproductive hormones. So what are these reproductive hormones? Progesterone and estrogen. So these hormones are actually what gives us our girly nature. That's what makes us look very radiant, beautiful, attractive. That's what makes the men turn their head when they look at us. That's the reason why as a woman is aging, you see it rise at a peak, and at some point you start seeing the natural, even no matter how young people look, the hormones are still actually fluctuating, reducing, and at some point it stops. That's when we say a woman is already at menopause. So what are the common symptoms that comes with menopause? Hot flushes, anxiety, low sex drive. This is the one that commonly affects marriages. And that's when you see men telling you things like, that's not the woman I married. She has changed. She is not as good as she used to be before. But these are not things that we can control. Like I said earlier on, menopause is a natural occurrence. There's really nothing you can do about it. The symptoms are countless. And what we experience during the day is different from what we experience at night. The mood swings and everything. So the mood swings are the things that actually even cause the problem that breaks homes. So how do we manage menopause? We can manage menopause with different methods. We have the hormone therapy, vaginal estrogen, and low-dose antidepressants. It's a long list. But why am I here today? I want us to explore the natural way to handle menopause and the symptoms. One myth I want to correct before I go into this is that menopause actually begins before menopause comes. There is a stage called the perimenopausal stage. This stage begins as early as 36 years old for some women, and it goes upward. So whatever it is, if you have a tank filled of water, the more you use it, it definitely goes down. So from the time we start the use of these hormones, they start to reduce. So the moment they start reducing to a particular stage, we start feeling the effects. A lot of women are treating malaria and typhoid by the day. But sometimes it is this menopausal symptom that are actually dealing with us. So we have the ginseng tea. Ginseng tea is actually very good. It's boost hormone. And it also boosts it helps with stress, and it also boosts our immunity. We have the valerian root. This is also a very good natural root that helps with insomnia and hot flushes. We have L-theanine. It helps with reducing stress, and it has the amino acid that we get from green and black tea plants. We have hoops. So this hoops it contains phytoestrogen. So this phytoestrogen actually mimics the effect of estrogen hormone. Why am I going through this? We also have the natural green tea. I know a lot of us have natural green tea on our shelves, even in our homes, that we take every morning. And that's because we've noticed that all these ingredients, at one point or the other, helps to relieve one or two symptoms. So now, sometimes women have a lot of supplements that we are taking. If you go to a woman's shelf, especially when we get to the age of 35, 36 and above, you will see different supplements that we are taking. If you ask what is this one for, they'll tell you it's for hair. What is this one for? It's for skin. What is this one for? I feel somehow sometimes, that's why I take it. But the good thing about the product I'm here to talk to us about is that it contains all these ingredients in one. Yes. It's, for us, Menorites is not just a brand, it's a passion. It's a drive, because we notice that this thing called menopause is ruining a lot of marriages, ruining a lot of relationships, and ruining a lot of homes. A lot of women have a lot of questions. They need answers. They are going for hospital appointments from time to time. They are walking around the pharmacies from time to time with a lot of questions. They need answers. But from experience, once you hit the specific, that woman stays with you because it looks like you've gone through all her symptoms. The beautiful thing about Menorites is that we understand that the symptoms a woman feels during the day is different from what you feel at night. You cannot put a medication for Menorites in one tablet when we understand that some of the problems is inability to sleep. So if you put a brand that has something that will make you sleep, do we expect you to be drowsy during the day? So Menorites actually have the AM dose and the PM dose. The AM dose is to help deal with the situations and the symptoms that we feel during the day, while the PM dose is to help deal with the situations and the symptoms we feel during the night, including boosting our mood, which is very key. That's the reason why a lot of our friends, colleagues, and co-workers think we are cranky. So like I said earlier, for us, Menorites is a passion. I would like to speak to all our beautiful and amiable pharmacists in the house. Our profession is very delicate and beautiful because no matter what the doctor recommends, when they come to the pharmacy point, our reassurance is the fact that we have the answers to some of the questions that were not answers on the doctor's table. And if you give a patient a brand, they trust you. So please, I'll beg all of us today, let's try Menorites for those people that come to us with these menopausal symptoms. Our families, our friends, our colleagues, our relatives. Menorites is something we should recommend for them. And for everybody that have used this brand, there have been a lot of beautiful testimonies, amazing stories, and a lot of relieving reports. I would also say we have a stand outside. You can come around and have further discussions with us. We have sample packs for you. And thank you very much for listening. I really appreciate your attentiveness. Thank you for your time. And I wish you a very beautiful delegation ahead. Thank you.
Thank you very much, Pharma Plus. I think she's the first presenter that actually stayed on time. A round of applause for her again, too. Okay, moving forward, we're going to go into the next presentation, which is by PharmaStreamTV. Are they available?
Okay, please, a round of applause for her as she comes forward. You know how to use your pointer? Okay, so you're pointing there.
As men of honor, good morning, everyone. I'm thrilled to be here this morning speaking to honorable people, senior colleagues, and the conversation today is something that I believe every one of us have had a form of interaction with, if not every day, at least in our community pharmacy setting. This is what it looks like right now, the war against malaria for us in our community and in Nigeria as a whole. With a global burden of about 27%, I want to be sure that a couple of patients, apart from the increasing mortality rate, we also have quality of life dropping just with the malaria incidences in our communities. And looking at this, as pharmacists, if we ask ourselves, are we really winning the war of malaria? With all the ACTs that we've used over time, or that we are familiar with, do we really have the same response that we've always emphasized with our patients, with the increasing resistance and treatment failure over time? Today, we are having increasing numbers, and this is why I say I'm not sure we are winning the war. But then I'll leave the question to us to answer at the end of the presentation. Now, these are treatment failure profiles from the WHO malaria report, showing the spread of treatment failure across the sub-Saharan Africa, where Nigeria is also located. And we can see the spread for diadratemicinin, peperaquine, artemether lumefantrine. And we can see not just the numbers, or not just the spread, is the percentage, is the 2 in 10 persons who don't get better after using the regular ACTs on the market. So what's the difference, or what has changed over time? What are the factors playing this key role in making this a different trend for us? We have 4, but we'll narrow down to 2 major ones, which is the drug pressure and the low compliance. For these patients, the patients are aware of artemether lumefantrine, for instance, and every HCP knows, pharmacists, doctors, we have a very large community aware of what ACT to use. Even most times before they come to us, they've already used artemether lumefantrine, right? But then, what's the difference now? And what's the difference with what we've been using before now? The pressure on the artemether molecule is increasing by the day. We have exposed the parasites over and over. And coupled with this is the low compliance. I don't know if everyone is like me, but there's something about that last dose of artemether lumefantrine. Is either I don't use it, or the first 8 hours, there's just something about it. And this is not just an experience for us. It's also what our patients also experience or they do not comply with. So there are different angles to how we want to change the patient experience. First, for the effectiveness of the medication, and also how they are able to stay on course with the product, right, till the end of the course of treatment. This is not just us. This is also a report from the WHO, and it is very, very important that not just the vulnerable, it's also me and you who are in the community pharmacy setting who are going to change the narrative for the patients. And this is why a new ACT is very important for us to administer. The WHO has brought a lot of innovations to help us with this. And the most critical one for us is the multiple first-line strategy, where they are advocating for us to have multiple ACTs available to patients so that you are not just repeatedly giving the patients the same anti-malaria. You are able to take from a diversified portfolio, and it interests you to know that even this has been adopted nationally and to be rolled out soon. We also have the National Treatment Guideline Review and the procurement plans, and the pharmacist sits in all of these conversations to make it change for the patients. We are key to this change, and we are looking forward to having the difference even big for every one of us. Now, introducing or adopting a new ACT is critical, looking at the trends of treatment failure and also the increasing resistance. And that is why we are here today, to introduce you the new standard of confidence, the science of pyronidine, which is now the first and the only fixed dose combination of artesunate pyronidine, and also being recommended by the World Health Organization as first line in treatment for your patients and even for you if you have malaria at any point in time. Right. For Pyramax, it is potent, is reliable, and it is simple. And I'll go through this very shortly. I mentioned that it's been added by the WHO as the first line treatment since 2022, National Treatment Guideline in 2020. And right now, we are looking at what is different about Pyramax. Artesunate, we know, it's a combination of artesunate and pyronidine, right? But then we've used artesunate over the years. So what's different? What's bringing the change to this equation? And that's the mechanism of pyronidine. Pyronidine is a benzonafthridine derivative, and it's been used over the years as a bloodstream insecticide for treatment of not just malaria, but also for resistant strains. And this beautiful combination has also been able to give us a lot of effective results in clinical trials. The mechanism of action of pyronidine, we like to call it a dual action. The dual action of the pyronidine molecule is so interesting. The first one is that it interacts in the parasite's food vacuole and inhibits the formation of hemazoin, which is what, when accumulated, leads to the clinical symptoms we see of headache, chills, and the likes. But then when this is inhibited, you have more hem produced and leads to the parasite death. The second one is the intercalation with the DNA of the parasite. What does this mean? It means that replication will be halted, and then you will lead to parasite death. There are many structural activities, but just because of our time, I can take two. The multiple nitrogen atoms helps with the protonation site and also helps to accumulate the pyronidine in the acidic vacuum of the parasite. And then the large side chain, this is very interesting because this is a major structural relationship that helps with, first of all, reducing the risk of resistance and also prolonging the activity of pyronidine in the system. We like to explain the relationship between artesunate pyronidine and also in the treatment of malaria as a marathon. So the artesunate molecule starts the race and reduces the parasite burden significantly to almost the baseline as the artesunate concentration increases. And then the baton is passed to the pyronidine molecule, which is our interesting molecule of concern. And it is not just going to keep the parasite burden low, it's going to suppress it for as long as 14 to 18 days, even after your use. And that is one major factor in our post-treatment protection. Pyramax is potent. Pyramax is reliable. Pyramax is simple to use. One of the testimonies that we've gotten over time from our booth is the truth in these studies that have been done. We have the Wanicam study and a couple of other studies that speaks to the effectiveness over time and also the fast parasite clearance rate because of the activity of the artesunate molecule and also the pyronidine molecule. Now, the fast parasite clearance, first of all, is attributed to the artesunate molecule because of the quick onset of action, but then the sustained protection based on the pyronidine molecule's half-life of about 14 to 18 days. And we've seen clinically that 8 out of 10 patients that use Pyramax are always protected at least 6 weeks after use. And we've also gotten feedback, even here in this conference, up to 12 weeks and even above. Right. So speaking to the reliability of this study, we had another indigenous study, that's the Nigerian study, in the pediatric population, and they are, should I say, they are a population of concern because of safety and tolerability. And this study was a good one for us because we had the feedback of effectiveness, efficacy, and also safety in children. And that is one of the reasons why we're here, to also let you see what the granules are able to offer your children. For the granules, you can mix with milk or juice for children, pediatric population. The efficacy is fantastic. Within 4 hours, you get alleviation of symptoms in your children, and they come in granules. Granules more stable, following the NAFDAC, the listing of artemether lumefantrine dry powder to suspension. This has been playing a key role, especially in treatment for children. You can visit our stand for all of that. So just quickly, I want to get to this is the reliability in real life. It's once a day dosing. It can be taken with or without food. The simplicity of this molecule can be studied much more outside here. We can have interactions at our booth. It comes in child-friendly granules. You just mix and take immediately. And also, this is the waiting dose. We have a chart for this at our booth. We can share with you if you really need to go through it. It's once a day based on the weight of the patient. It's taken once a day with the granules also once a day. So there's no difference in the dosage for the children and the adults. It's potent, it's reliable, it's simple to use based on the studies that we've done and based on the feedbacks that we've gotten from people like you or from a couple of pharmacies that have it at the moment. We also have at our PharmaStreamTV stand Colostrodam, which is very great in wound healing. We have Everfix, our chocolate-flavored cefixime, and also Sedum Vitacid multivitamins, which a couple of you have had a taste of in this conference. We would like you to visit our booth again. Try Malaria, our anti-malaria Pyramax for your children and for adults today. Let's change the face of the war. Let's win together as pharmacists, and let's bring potent, reliable, and simple solutions to our patients. Thank you very much.
She wants to know if she has any question from the audience. Do we have any questions to ask based on her presentation? You understand everything. They'll come to you at your stand if they have any questions to ask you. Thank you very much. A round of applause for her again. So we've been having a 3-day conference, right from when we started with our first masterclass by Pharma, which was on integrating advanced nutraceuticals into clinical pathway. From there, we moved on to navigating hyperpigmentation in community pharmacy using global best practices. This was given to us by pharmacist Wilson Opani. We also had oxidative stress in modern living, clinical implications, prevention, and management, which was held yesterday by Dr. Victor Akinwusi. We had another workshop yesterday, and today our final master class will be given by Carrot Top Drugs Limited. They're going to be speaking on beyond symptom management, evidence-based protocols for total health optimization for your patients. Like the theme of our conference is, which is advancing community practice through technology, collaboration, and expanded services. So how better to expand these services that we give to our patients, but through evidence-based protocols. So please make welcome from Carrot Top Drugs. Let's put our hands together for our speaker, pharmacist Gegele Ibrahim Olalekon from the Pharmaceutical Microbiology Department. Please, a round of applause for him as he comes forward. Okay. If you don't know how to point your... Okay.
Hello, pharmacists. As men of honor, today we are going to be discussing the topic beyond symptoms management, evidence-based protocols for total health optimization for your clients. We're going to be discussing evidence-based protocols for total health optimization for your clients in terms of fertility care and wellness care. My name is pharmacist Gegele Ibrahim. By virtue of my qualification, I'm a biochemist, a pharmacist, and a pharmaceutical microbiologist. Today's presentation, I'm going to be making this presentation on behalf of Carrot Top Drugs. Carrot Top Drugs are fertility and wellness solutions company. I repeat that again. Carrot Top Drugs are a renowned company for fertility and wellness solution. The first topic we are going to be discussing today is going to be on conception. Under conception, we are going to look at timing. Pharmacists, are you aware that not all patients, not all clients that have come to you to talk about infertility problems, that are actually having fertility problems? One of the leading causes is because they don't even know when to meet. When couples are unable to time the intercourse, the case is just going to be the case of shooting out of proportion. It shoots, it's almost hit it, but it's not going to hit it. And also under this topic, we are going to look at how egg is fertilized and when is it fertilizable. Let me remind you in this gathering that egg is only fertilizable for 12 hours. What it means, once it drops during the time of ovulation, it's only available for 12 hours for fertilization. What that means is if there is no fertilization within that 12 hours, they can never have a baby. It's not a rocket science. That is to tell you how important timing is. So when a client walks up to you as a community pharmacist, you're expected to ask this question: do you even time your intercourse? Do you know your fertile time? Do you know when you should meet? That is very important. Also, I want to remind us that every girl child that is born has come with a follow-come egg. Once a girl child is given birth to, she has come with all the eggs she's going to use in her life, throughout her lifestyle. What that means is only 25% of chances when you have couples meeting regularly, when they meet around the time the woman is ovulating, timing, they only stand a chance of having a baby in 25%. When they meet 4 times, they only stand a chance of having a baby 1 time. That is 1/4 for every 4 meetings around the time of ovulation. That is for us to appreciate how timing is. Even with timing, the probability of having a baby is still very low, 25% of 100. That is the second factor we are going to be looking at under conception. We've talked about timing. We've talked about the chances of even having a baby when the sex is timed. Gender selection is also possible with accurate timing. They want a boy child, a female child, or a male child. It can also be selected when your client knows something about timing, when they know the right time to meet. What are we talking about in this? Let's flash back to our elementary biology. We remember Y and X chromosome. Y chromosome is faster, but it dies off quickly. X chromosome is slower, but it stays longer, even up to 5 days. When couples are aware the woman is going to ovulate in the next 12-24 hours, if they have intercourse around that time, there is higher chance of having a male child because Y chromosome is still available at that time. When couples are aware of the time of ovulation, when the woman is fertile, there is higher chance of having a female child if they select well. It's just to delay the intercourse before the ovulation time so that the Y cell must have died off, leaving the X to come and fertilize the egg, and there will be a female child. I hope you are well reminded about that. Now, I want to introduce a solution. There is a device that can be used to achieve timed intercourse that can be used even for gender selection. The device is called Predict Ovulation Test Kit. It's one of the products of Carrot Top Drugs. In fact, it's their flagship brand, if I'm not mistaken. This Predict Ovulation Test Strips has 5 test strips. It comes with urine collection bottle. Your client does not need to collect urine into any contaminated container that can further affect the concentration of the urine. It has 1 free test strip for pregnancy test. You don't need, your client does not need much stress about this. Just refer them to the leaflet. This leaflet is self-explanatory. It uses urinary luteinizing hormone. When it's about time for a woman to ovulate, the luteinizing hormone surge will increase. There will be 2 bold lines on the strip if she's actually going to ovulate around that time. The control line and the test line, which indicates she's going to be fertile within the next 24 hours. The only precaution, what you need, your responsibility as pharmacist, is to educate them about how to calculate their length of cycle. Can I remind us? From the day of menstrual bleeding to a day before the next one. How many days interval? Once they know, they establish it's 24 days, it's 25 days, then refer them to the leaflet. The leaflet inside pregnant ovulation test strip indicates when each length of cycle should begin to test. 26-day cycle, she will see day so. 24-day cycle, she will know she's going to start testing on this day. So pregnant ovulation test is a clinically formulated device that helps to pinpoint the most fertile day in a cycle. It can also help in gender selection for your patient because the timing has been known. We're going to look at health and quality of oocyte as it matters. In fact, it's a great deal. When the quality of egg is good, then the problem is almost solved. When the egg quality is not good, there is nothing that can make the egg to now turn to a zygote or embryo. So how can you help your patient improve the egg quality? We'll look at certain factors. Like I mentioned earlier, girls are born with all the eggs they will ever have. We mentioned this. How can you protect this egg? How can you conserve this egg? Egg quality drops with age. You agree with me? 20 to 25 years of age in women, the fertility rate is higher. When you see 35 years up, 40, the quality of egg begins to drop. It's a natural phenomenon. But you can actually help your clients that are in this category. Environmental factors like reactive oxygen species, oxidative stress, also affect the quality of egg. Radioactive radiation and co. affect the quality of egg. Diet and co. What that means is no individual can actually say, I can protect my egg quality. We all can help by giving them this orientation, by helping them with certain things that can actually enhance the quality of egg. There is a solution to that. There is Evergreen Egg Boost. Evergreen Egg Boost is a clinically formulated supplement. It's a product of carrot top drugs. It contains myo-inositol. It contains coenzyme Q10. It contains melatonin, folic acid, and vitamin E. When I mention vitamin E, I know pharmacists already know I'm talking about oxidative stress. Vitamin E and grapeseed serve as an antioxidant. Why the coenzyme Q10 and myo-inositol? Let's flash back to cell division. The mitosis leads to growth and development. Meiosis leads to multiplication process in fertilization. Now, the cell division is aided by the quality of energy in the mitochondrion of the cell. So the mitochondrion of the cell is helped with myo-inositol and CoQ10, and that is what the Evergreen Egg Boost offers. So when we mentioned preserve and protect the hair quality, myo-inositol and CoQ10 in Evergreen Egg Boost, when you talk about protecting from oxidative stress or free radicals, we talk about vitamin E and grapeseed extract in it, even melatonin. When I mention melatonin, the pharmacist will look at it like, are we talking about sleep cycle here? Melatonin has other important functions. It can also serve as an antioxidant. In fact, it's a muscle relaxant. Cell division occurs only when the cells are relaxed. And that is why you tell children to undergo siesta to enhance their growth. The same way melatonin helps to relax cells so that effective cell division can occur, and there will be production of quality oocyte to keep your patient going when you talk about fertility. Dealing with idiopathic infertility. This is a case. Idiopathic infertility is the kind of fertility which the cause is not known. You cannot explain it. They've tried so many things, yet the patient is unable to conceive. Tried, the egg quality is good, the sperm parameters are fine, but yet the usual suspects when you talk about problem of idiopathic infertility is oxidative stress or free radicals. Free radicals contribute to 2 out of every 3 infertility cases. And that is why WHO recommends that free radicals effect can be taken off or eradicated using antioxidants. So we'll look at this slide critically. Dealing with idiopathic infertility is the slide. Then we'll look at this. Factors that can actually contribute to idiopathic infertility. There is hormonal imbalance, when the estrogen level, luteinizing hormone level, follicle stimulating hormone levels are not balanced. Another factor that can contribute to this is irregular cycle. When the menstrual cycle is irregular, then polycystic ovarian syndrome can also contribute to this. Then what is the solution to override these factors? There is evergreen formula for men called Mom2B. Mom2B has 4 categories of ingredients. It has antioxidants in vitamin A, C, and E. Antioxidant to mop up the free radicals that can affect the quality of egg. It has zinc and folate. Zinc helps the oocyte to mature. It helps it to undergo that early traveling, ovulation. When it gets to where it should be fertilized, it may not be fertilized if the zinc is inadequate. It also helps the fertilization to occur. It contains zinc and folate. Folic acid protects the egg. This third category of ingredients contains vitamin Bs. Vitamin B12 especially supplies the energy for day-to-day activity of the egg cell. And lastly, it contains vites. Vites is chasteberry in its flavonoid form. Vites help to balance the dopamine level. Guess what? When the dopamine level is balanced, hormonal activities are restored. So when we talk about hormonal imbalance, evergreen formula for men will help your clients. Note that not only the trying mothers, even ladies that are having hormonal imbalance, like hyperprolactin, hyperhidrogenism, can also benefit using this because it restores hormone. While the fertility aspect of it are taken care by zinc and vitamin E, even chromium, also helps in cell division. Evergreen formula for men, the dosage is 1 CDS for a period of 3 to 6 months. We are going to be looking at the next slide. Vaginal dryness can be a barrier. Yes, when there's problem of infertility, vaginal dryness, which is popularly known as dyspareunia, can actually be a barrier. 75% of trying to conceive report increased vaginal dryness. Why? Due to intercourse on demand around ovulation. They want to have intercourse at all times around ovulation. Fertility medication. There are medications they use to aid their fertility that can actually affect that can actually cause vaginal dryness. Fear of failure. I've been trying for many years. What is even the assurance if I try this time around, it's going to still work out? You know how anxiety can have a factor. Look at these statistics. 46% of TTCs always or often use lubricant. You know what I'm talking about. Trying to conceive will always come to you to buy lubricant. And let's look at the danger in this. If 46% of TTC always or often use lubricant, most lubricants harm the sperm because the pH and osmolarities are not ideal for the sperm. That is to tell us that not all lubricant can actually help the sperm cell or are actually healthy for the sperm cell. The optimum pH value for sperm migration and survival in the cervical mucus is between 7.1 and 8.5. 7.1 is a neutral scale. 8.5 is slightly alkaline. So this is good for sperm cell. We'll look at physiologic osmolarity between 260 to 360 milliosmoles per kilogram that of semen is best for sperm. The reason why I'm sharing these parameters, we are heading to somewhere. So I want you to pay a good attention to this. Handling vaginal dryness without compromising sperm qualities. I want to share these statistics with you. I'm going to pick a few of these lubricants. I'm going to pick KY jelly, which you all know. Look at pH. The normal physiologic pH sperm for sperm to remain healthy. You see between 7.0 to 8.5. And you see the osmolarity is 260 to around, the osmolarity is between 260 to 360 milliosmol per kilogram. So let's look at KY jelly. You can see the pH value is around 4.52, which is acidic. Have you imagined sperm cell dwelling in an acidic medium? No way. Look at the osmolarity. Greater than 1,000. There is no sperm that can survive this. I look at baby oil, mineral oil, or let me pick baby oil. This is another important, another popular lubricant. 7.16, the pH value. Then look at the osmolarity. Also greater than 1,000, also too high. Now, ladies and gentlemen, how can you help your clients to keep the sperm that is traveling through the vagina, through the cervix, to the fallopian tube, to remain healthy, even when the sperm is okay, when the sperm is healthy? There is a clinically formulated lubricant. It is isotonic to sperm cell, water-based, does not contain paraffin and glycerin. In fact, it swims the sperm. It's not hostile to the sperm. It even takes the sperm to where it is needed. The device, this lubricant, is pre-seed lubricant. Let's look at pre-seed lubricant. Physiology for sperm, it maintains 7.1 to 7.4. Then the osmolarity is 314, which is healthy for sperm. No wonder. NAFDAC approved pre-seed lubricant as the only fertility or sperm-friendly lubricant registered in Nigeria. And when you want to help your patient to take care of infertility cases, and a patient, you probe the patient, and there is an issue of vaginal dryness, the only registered lubricant by NAFDAC to be used that is not going to have any detrimental effect to sperm is pre-seed lubricant. Moisture from inside is another topic. The ability to produce moisture from inside is very important. Abnormalities of cervical secretion may account for up to 8% of female infertility. 8%. When there is no adequate cervical mucus secretion. Then we'll look at this again. The next point under this slide is, the rate of production of cervical mucus depends on many factors. Cervical mucus should be produced naturally, but the rate of production also depends on factors. Clomiphene citrate affects production of fertile quality cervical mucus. Yes, it has estrogenic effects. In fact, it dries up the cervical mucus. So for every client that has been induced one time or the other by clomiphene citrate, there's every tendency of that patient having dyspareunia or having inadequate production of cervical mucus. So we have the solution to for the management of inadequate cervical mucus. There is Evergreen CM. The Evergreen CM contains coral calcium. Let me remind us, between the day 2 and day 14 in the cycle, the vaginal wall is acidic. And the reason is there is every production of lactic acid by the vaginal wall. This production by the vaginal wall is to prevent bacteria from growing because there are a lot of secretion at that point. So the production is supposed to be neutralized by coral calcium, which is calcium hydroxide. So because it is not adequate, the vagina remains acidic, and that is where Evergreen CM comes in to take care of that. So when there is ovulatory dysfunction, there are many clomiphene citrate, but let me start with my own brand. The brand I'm talking about for carrot top drugs, which is Ovumai clomiphene citrate. The benefit this has over other brands, it has, every clomiphene has 2 geometric isomers, which is enclomiphene and the zuclomiphene. The WHO recommends that the enclomiphene should be 62%, while the zuclomiphene should be 38%. Ovumin actually complies with that, and that is why when Ovumin is used side by side with other clomiphene citrate, it gives a quicker, faster result with lesser side effects. We'll look at the next slide, which is the next slide is now there's a better option in ovulation induction. The better option in ovulation induction with higher ovulation and pregnancy rates in pregnancy in PCOS, it has lower risk of multiple pregnancy. This particular option also has a shorter half-life, lower risk of multiple pregnancy, better endometrial receptivity. Why most of the doctors, gynae doctors, are now shifting focus from clomiphene citrate to this, and the brand is that shorter half-life and more predictable action. The brand we're going to be talking about that gives a better ovulation induction is Letromine, which is a brand of Letrozone from Carrot Top Drugs. It has a price advantage. The manufacturer has integrity and is also available at Carrot Top Drug stand. Then we'll look at when fibroid, leiomyoma interferes. It can actually interfere with pregnancy. Depending on their location and size, fibroid can interfere with the process of conception. So there is this generally acceptable method. The current common management is surgery. You all agree with me? Then some patients are not ready or fit for surgery. Yes or no? The answer is yes. Not all patients are ready or fit. Then I want to introduce to you a supplement that works using multiple cellular pathways. This supplement works by anti-proliferation effect. It has 3 ingredients: the epigallocatechin, which is a green tea extract, EGCG. It has vitamin D3 and B6. This ingredient works synergistically together to shrink fibroid using cellular pathways by preventing cell proliferation. Cell cannot grow, bacterial cell cannot, fibroid cell cannot grow again. It has anti-angiogenic effect. Angiogens are the small blood vessels that takes blood to the fibroid cell. It downgrades it. It has apoptotic property, program cell death. There are certain proteins that allow fibroid cells to grow, like cyclid D4 and cyclid CDK4. These proteins are downgraded. Fibroid cells are now failed. They are unable to grow. And it has anti-estrogenic effect. Estrogen actually makes fibroid to grow. It balances the estrogen level. The product is called FibroFlux for fibroid. Then we'll look at the next slide, which is sexual dysfunction in women, pain during intercourse, involuntary painful contractions, spasm of the muscles around the vagina, which is vaginismus. There's a product that has a pure herbal formulation, maca root, L-arginine, L-carnitine. It also has fenugreek and it has L-arginine, fenugreek, maca root. Lack of interest in sex or libido can also be a factor. So the product we are talking about here is Evergreen Action for Women. I don't know. Problem with arousal orgasm is also available at Carrot Top Drug stands. Mate fertility matters. For fertilization to occur, the sperm must be fertilization, it must be of right quality, it must be of right quantity, and also the sperm cell must be able to swim, the right morphology. It must have the right shape. So there is Evergreen formula for men that contains zinc it has zinc, selenium, and CoQ10 for spermatogenesis. It has antioxidant in vitamin A, C, E to protect the sperm cell. I'm sure this is also available at Carrot Top Drugs and to manage low sperm count in your patient. The sperm must be able to swim. The sperm has to swim a total distance of 15 to 18 centimeters to get to the fallopian tube where fertilization occurs. From vagina to cervix, from cervix to uterus womb, through the cervical canal, uterus to fallopian tube. This is like a human swimming 5 kilometers non-stop to reach a destination for sperm to travel. To make matter worse, unlike the human who swims through water that offers minimal resistance, the sperm has to swim through thick cervical mucosa. That is a resistance. The sperm must be at its excellent performance to be able to navigate this. The sperm needs help, ladies and gentlemen. And the help is motility for men, Evergreen motility for men, which contains L-arginine, L-carnitine, CoQ10. This ingredient capacitates the mitochondrion of the sperm cell. They also capacitate the acrosome. The acrosome is the head of the sperm. They actually react with the thick wall of the egg, corona radiata. The wall is so thick that if the sperm is unable to swim well, it's not going to be able to break through. They allow petrosine, spermine, and spermidine. These are ingredients that allows acrosome reaction. And when it cannot get up, the next slide, when it cannot get up or make it stay up, male erectile dysfunction, inability to get or maintain an erection firm enough for sexual intercourse, affect conception. It causes difficulty with vaginal penetration, incomplete ejaculation, reduced frequency of intercourse, physiological stress, and also, even though erectile dysfunction may not affect the quality of sperm, it affects its delivery. It may not affect the quality, but what of the delivery of sperm? What to do? There's a clinically formulated ingredient called Action for Men. Action for Men has 8 herbal ingredients. It has maca root, ginkgo biloba, panas ginseng, epimedium, honey goat weed. All these ingredients work synergistically to give aphrodisiac effect. They give erectogenic effect. They give endothelial improving activity, and they have anti-atherosclerotic effect. Hypertensive patient can take it, unlike sildenafil and tadalafil. Action for Men cures. It has curative effect. It's a product of carrot top drug. Finally, the deed is done. We expect that after managing the male and female infertility, early pregnancy, there is time to confirm. If the patient is not aware she's pregnant enough, she might be on some medications that will terminate the pregnancy. So early pregnancy detection allows early care, safer choices, and quicker response. It also reduces the risk of miscarriage. Early pregnancy needs to confirm pregnancy early enough, even before she misses her period. I want to introduce to you Predict Pregnancy Test Kit. It's also available in carrot. It uses both serum and urine, and it's ultra-sensitive. It can detect pregnancy within the first 1 week of conception. It is official. She's pregnant. There is a clinically formulated supplement that has all the ingredients in one tablet. When the patient takes it, she gets all. I guess the problem with most of pregnant women is they don't want to take their medication. So when you can achieve compliance, all the ingredients are in one tablet, then you have achieved what you want to achieve with a patient. So the product, pregnancy places additional burden on women's micronutrients. It has maternal micronutrient deficiency during pregnancy, can give rise to complications such as anemia, preeclampsia, and co. To prevent this, to help your patient, there's Evergreen Natal Care that contains 800 micrograms of vitamin or folic acid and 3 micrograms of vitamin B12. It has calcium, 200 milligrams, and other essential ingredients. Before this slide, please walk with my pace. Before this slide, I want to bone care the tasty way. There is Evergreen Bone Support, which has calcium, magnesium, and D3. Over 5% of patients report difficulty swallowing tablet. This is chewable. My colleagues will be going around, and when you visit Carrot Top Drug Stand, you are going to get a free sample. And there is also a packet that is going to be shared within this premise for you to taste, so that when you are talking to your patient, you are sure of what you are introducing to your patient. 8% skip doses entirely, and that is where chewable nature helps in this case. It is a nightmare getting your patient to take their tablet for a long period of time, as it's required for both patients on D3 alone. So there's also Evergreen D3, which is 5,000 IU. This one is not only chewable, it's not chewable, it's fast melts. Once it is placed on the tongue, it melts. It is coated with monk extract, so it is also diabetic friendly. You can see the two. My colleagues will be distributing this as during the course of this presentation. Hemolysis, the hallmark of sickle cell crisis. Hello, pharmacists. I want your attention in this. Every home has a sickle cell patient. And this product I'm about to talk about, or this slide I'm about to talk about, is going to help the sickle cell patient. Do you know mixed tissue with high level of antioxidant can help sickle cell patients prevent and remove damaging effects of free radicals? Hello? Sickle cell patients can be helped. The hallmark is not because, hello, the shape of their red blood cell is already sickled. Certain stress, oxidative stress, physical stress can affect the shape. The normal red blood cell has 120 days lifespan. That is approximately 4 months of a non-sickle cell. In sickle cell, it doesn't stay up to that. Premature destruction of red blood cells easily destroys their red blood cells. If you can protect their red blood cells, that means they can be helped. Silimarin or mixed tissue produce the highest level of antioxidant. It produces NAC, N-acetylcysteine. It produces glutamine. It produces vitamin A, C, and E, and other antioxidants, including L-arginine. So the antioxidant here will protect their red blood cells from oxidative damage and even dehydration. Once they can stay out of this, you have helped them. That is not to say sickle cell has been cured. Now, I want to share a personal testimony with you. You know, as a medical personnel, what you experience from someone close to you will give you a lot of confidence about certain things. Sometimes in 2024, I have a very close family member who has a sickle cell child. This child we are talking about had crisis in school, and at the point they called the father that the boy had convulsed. He was taken to the nearby hospital. On getting there, they checked the parameters, the full blood count. The PCV had dropped to 16%. The white blood cell count around 27,000. That is sepsis. Every other parameters were bad. Normally, it was transfused that same day. One would expect the PCV to come up after the transfusion, 48 hours. Post-transfusion, the PCV further dropped to 13%. Do you know what has happened? The hemolysis, the red blood cell, even the new blood that was transfused kept breaking. Then it was so jaundiced on the third day, so yellowish in color. They had to refer to the teaching hospital. On getting to the teaching hospital, they checked the bilirubin level. The bilirubin level has also gone so bad that it was around 127. An average bilirubin for an adult should not be more than 4. This boy bilirubin has gone to 127. He was having recurrent seizure. He will convulse, wake up, convulse, wake up. He could have convulsion 10 times in a day. So he was taken to hematology department of the hospital. He was bid for exchange blood transfusion. They were going to remove the blood and pass another blood to him. Then in an effort to garner the money, it was on a Friday evening, they said there was no bed space again. They needed to come back on Monday. I was thinking he was not going to make it, actually. So the family member, a senior brother, said, okay, we'll go home. We'll return on Monday. On Friday evening, he called whether there was something they could use. Not because I believed something was going to happen. Because I saw the yellowish coloration. It was peeing reddish urine. The red blood cell kept breaking. I only mentioned, can you use detox? And I asked him to get the detox somewhere. He actually got it. Even on Saturday morning when he called, early in the morning, I did not want to pick the call. I thought he wanted to pass the news that the boy had gone. He told me the boy wanted to eat. He could not sit. He was always lying down. So to cut the story short, he was presented before the hospital on Monday. He was okay on Monday. But I did not want to take the glory, even when they kept calling. This boy is fine. The family member, I said, just take him to the hospital on Monday. Because I didn't see him making it with that bilirubin level. Pharmacist in the house. On Monday, the bilirubin level was checked. It was 12, dropped. The white blood cell level has now come to around 10.7 or so. The PCV, 21%. No transfusion. Then the hematologist said, what happened? My brother hesitated. Then later he said his brother gave him certain thing, which was detox. I didn't know detox was going to reverse the liver enzymes that have been bad. What has simply happened? The hematologist now is, you see silimarin in detox actually helped to restore the bilirubin level in this boy. The bilirubin had been transported to the brain. That was why he started having seizure. The seizuring has stopped. The white blood cell, because no new blood was able to be produced, the blood kept breaking. That has also been restored. Then he was not admitted. He was only asked to keep taking folic acid, the proguanil, and other routine medications. Since then, this doctor we are talking about, Dr. Afolabi, in University of Ilorin Teaching Hospital, has been using detox up to today. He consumes it like water. I've also introduced this to many of the doctors and pharmacists. You can also help your patient using Evergreen Detox. That is my personal testimony on detox. And what you will get when you come to Carrot Top Drug Stand, free bone support, combination of calcium, magnesium, and D3, There is a power bank gift when you buy 20 packs of Evergreen Daily. Evergreen Daily is a soft-gel multivitamin with biotin, amino acid, and co. Also, there is another gift on Evergreen Elahati, which is electric jug. When you buy up to 200,000 worth of Elahati of carrot top drug, you get an electric jug. And also, there is work clock gift, which is when you buy Natal Care from carrot top drugs. The Natal Care, like I said, it contains all the vitamins and minerals. Also, there is Letromin clock. When you come to Carrot Top Drug Stand, you get all a special discounted price, which is conference price. Ladies and gentlemen, pharmacists in the house, this is a summary of all the gifts when you visit Carrot Top Drug Stand. I thank you all for the time, and God bless you. Thank you.
Thank you very much, sir. Fam Ibrahim, thank you for the beautiful presentation. I think you did not get something you said that aroused the crowd. Should I tell him what he said? You said every family in Nigeria has a sickle cell patient. Is that not what he said? And everybody said...
Okay, can I explain that?
Please do.
Okay, a family I meant is not...
Like there knows
somebody.
Family
in the generation, you will always have one. Maybe family of A. Maybe the first generation... second generation or third generation, you only have somebody you can help. That is what I meant to say. Not every family here. Not every individual family here.
Thank you for the clarification. Thank you very much. Are we settled now? Thank you very much. No again. Okay, now we will move to questions. Do we have any questions for Pharmacist Ibrahim? We are going to take 3 questions, starting from here. Okay.
Let me make a comment to Good morning, colleagues. Good morning, colleagues. Excellent. So I want to give a quick clarification. They've been giving you brochures, and then there are tablets attached to it. There's a dispensing nylon on the brochure. There are 2 tablets there. The small one is the D3. It's actually a fast melt tablet. So I would like you to please put it on your tongue and experience it. That's actually the idea. If you put it on your tongue, you see it will melt instantly, leaving a very pleasant taste in your mouth. And that's what you want your clients to experience. And interestingly, you may be wondering, if this taste is good, is it good for diabetic patients? The answer is yes, because it's sweetened with monk's extract. So please, can we do that now? Then the other one is a sample of the D3, of the bone support you talked about. The bigger tablets is the bones, but that one is chewable. That you also be getting one full bottle for your own use when you come to our stand. That's what he tried to say. I'm sure as he was hurrying to meet up with time, some of these details were not very clear to us. So can we please test? So even as we test it now, we can comment on that. Thank you so much.
Thank you very much. All right, sir. So the first question.
Thank you for this very beautiful and thoughtful presentations. But my question is just to find out whether the one for women in particular, for fertility, I can't remember the name now. Has there been any studies on premenopausal women that has very low antimalarial factor? Can you improve their chance of conceiving?
All right, thank you. I should answer all or one?
No, answer as they ask.
Okay, the products is the Evergreen formula for men. For women. So Evergreen formula for women would help every trying to conceive, even premenopausal or postmenopausal. I talked about hair quality. I mentioned environmental factor. I also mentioned free radicals under the environmental factor. I also shared a research work that was done that 2 out of every 3 cases of infertility have been attributed to damaging effect of free radicals on the egg cell. So if a premenopausal woman takes Evergreen formula for women that contains high level of antioxidant, she has nothing to lose rather than what to gain. She's going to be helped because the damaging effect, you would agree with me, that not only age affects the quality of egg, factors like free radical can affect even a woman that gave birth last year may not be able to conceive this year again. So because the free radical effect have been taken care of by the the antioxidant vitamin A, C, E, and the congenital deformity possibility have been taken care of by folic acid. So every woman that is taking evergreen formula for women is going to benefit from it, sir, for infertility cases specifically.
Good morning.
Yes, that is why the brochure is being shared. There are documented evidences on what are being used and the results. There are peer reviews also, all documented. Yes, sir.
Thank you very much. The next question.
Good morning. My name is Dennis, and I represent First Consult Pharmacy. My question is this. When you were talking about fertility, I was waiting to hear one word, but you didn't mention it. What is the success rate of having twins with your fertility supplements?
Okay, thank you very much for that question. The fertility supplements that we all know here that can make your client to even have quadrets, triplets, is clomiphene citrate. Clomiphene citrate would achieve this. You know, clomiphene helps to stop estrogen abnormality to the hypothalamic axis. Once that is stopped, more follicles are recruited. That is follicular growth. Remember, the more follicular growth, the more egg production. And that is when the tendency of having even triplets is achieved using Ovumi, which is a brand of clomiphene citrate by Carrot Top Drugs.
All right, thank you, Mr. Ibrahim. A very good presentation, I must say. We give you 95%. I can hear my colleagues saying that here.
Thank you, sir.
All right. On fibro flush, for those who have actually undergone surgery, can it still help prevent further fibroid coming up or growth?
That's a very important question. Hello? Please, this question, I want to say it the way he said it. Those who have had myomectomy to remove fibroid, is that the final solution? The answer is no. But that is not his question. There is every tendency of fibroid regrowing, even after removing it. And that is where the epigallocatechin, which is one of the ingredients in fibroflux, helps. What makes fibroid to behave like it has good skills is because estrogen continues to supply its food. Because it continues to get blood supply. Because it continues to accumulate extracellular marks from the environment. The EGCG has antifibrotic effect. It will not accumulate any extracellular marks. It stops its blood supply by downgrading the blood vessels. That is anti-fibrotic effect I mentioned, which is angiogenic effect. Angiogenism, production of blood vessels.
Thank you.
And the anti-estrogenic effect, the estrogen level is normalized as long as the patient completes the treatment within 4 to 6 months. Thank you, sir.
Thank you very much for that.
Okay, thank you. Thank you so much. I'm pharmacist Michael Gwefi. I have to thank you because I think we got 1 or 2 very important information from this lecture. Because now we have known that for fertility to take place, the pH is very important, and the osmolarity is also very important. Because if we check into our practice, we have community pharmacists. You discover that most of the KY gel is the one that is more. I think most of us are more aware of it. It is even now that this year Preside gel. I know about it before, but with the explanation you have now made, I think we can now say maybe if somebody is looking for maybe to conceive, I can always go for Preside, but if it is just to have fun or that kind of a thing, maybe other ones, we can go for other ones. Thank you.
Thank you so much.
All right, thank you very much. With no further questions, please a round of applause for Dr. Pharmacist Ibrahim. Thank you very much.
Thank you.
I'll call you, sir, but just a minute. Okay, moving forward. Can we all rise up so we can stretch our legs? Just a minute, please. Let us quickly rise up. We remember all our facilitators have told us about the sitting disease. So please, let's stretch to the left, stretch to the right, bend over, try to touch your knee or your toes, depending on how far you can go. Lift your hands up. Let's go sideways and down. Can we go up again? Sideways and down. Can we go up, sideways, and down? Thank you very much. Please do have your seat. So I'm going to be calling up now Moxie for their presentation. A round of applause for Moxie as they come forward, please. Also, please, can I announce someone forgot this diary? There's money inside if you have any form of confirmation for this. Please come and pick it up in front here. Thank you.
All right. Good morning, everyone. Elders in the house, fellows of the profession. I'm here to just share a few kind words from this table of Moxie to everyone. In a few weeks' time, Moxie will be 7 years in the Nigerian market. And we just want to say thank you to all of you for the support you have given the brand since inception. Thank you very much. However, a number of us don't know where the story started from. And I'd like to appreciate the state chairman, Pharmacist Tolu Ajayi, for this great opportunity to continue to collaborate with Acpn. All right, so I'll just tell a quick story that a few of us know, but not too many of us may know. Sometime in 2017, after a lot of NAFDAC issues was practically frustrating the profession, a few of us, I was approached by a few people that, look, let's look at the way out of this issue. And I'm happy with the session we had yesterday, which at least showed that some progress had been made over time. Because those were the days where they would go with guns and making us look like criminals. And so, yes, we had a stakeholders meeting. And, So we had a stakeholder meeting, which was industry-wide. NAIP was there, NairoFarm was there, Acpn, everybody, to say what's the way forward. And after that, we came up with this position paper, which was taken by Acpn National to NAFDAC to engage constructively. After the whole incident happened, there was just one takeaway for me after the whole incident. What is it about imported drugs that we cannot produce locally as Nigerians? And so we looked at the market and decided to pick two lines, paracetamol, vitamin C. Because NAFDAC was going about Calpol, UK, that was what some of the things we were looking for at the time. And so we picked two items. We picked Calpol, UK, and Child Life, vitamin C. And we took it apart to say, what is in it that we Nigerians cannot do for ourselves? And after all the dimensioning, we found out three things. We found that in a decision-making moment, the priorities for all our stakeholders are different. And so we have three primary stakeholders for the brand: the children, the mothers, and the pharmacists. So what do children want? The most important thing to children when it comes to medicines is the taste. And mothers will tell you the same. Followed by taste is the issue of the ease of swallowing. So they prefer syrups and chewable tablets. And of course, the medicines must be visually appealing. from the pack even to the liquid, and then must feel like something nice, not as if they're undergoing punishment. The next thing is that they want the medicine to work and give them quick relief. So for the child, quick relief is like last on the agenda, but taste is most important. In summary, for children, they want the medicines to feel like a treat and not punishment. What do mothers want? Mothers want safe medicines. It's found that safety is very important to mothers. Efficacy is number 2. Number 3 is the brand reputation. Okay? And then pleasant tasting medicine that they're easy to comply for the children, and that goes back to taste. And of course, women want value for money. Mothers, when they are buying medicine, they want peace of mind and not just medicines. And what do we community pharmacists want? We want medicines that work. We want medicines that are safe and tolerable. We want brand credibility. Of course, it must make commercial sense. And then the patient should accept it without a fuss. And so in 2019, the brand Moxie was born, and then we started with vitamin C and paracetamol. But the question is this: what makes Moxie different? What makes it tick? Number one, we spend a lot to make sure that we get premium raw materials. Right? We just don't use any kind of raw materials. When I say, especially the APIs, both our paracetamol granules and ascorbic acid. At the time of inception, we used DSM, which was an offshoot of Roche, as we started the Moxie vitamin C production. Then, of course, number 2, our packaging speaks for itself. And even though we never said we were imported, a number of you have erroneously been telling your customers that this is an imported brand. We did not say so, but we are openly declaring now that this is a proudly Nigerian brand. The taste, thank you very much. The taste is our biggest selling point. The children love Moxie. And that's why for you as our community pharmacists, we only ask of you one thing, just one thing. Recommend the product and let the product do the selling by itself. If any child takes Moxie, and like most of you know, mothers have now they are now abusing the medicine because they now use it as bribery. They say, take this one, and when you take this one, I'll give you Moxie. It's now an incentive for the children to take their medicines. And also we have, like we all know, the child-resistant cap. When we were going to come into the market in 2019, there was one thing characteristic about drugs made in Nigeria. They were difficult to open. You either needed a knife or whatever, but there was another problem. After you open it, how to close it? Because it will now start rolling on its own. So for us, the resistant cap serves 2 purposes. Ease of opening for the parent, but then also, because of its wonderful taste, protecting the child from overdosing. Because the child can just climb table and then want it, but then the children cannot open it because it's a child-resistant cap. And of course, in the Nigerian market, Moxie paracetamol is the only brand in the market that has a oral dose that uses syringe dosing. And then, of course, our barcoding and all. So let me move quickly. And so, like I said before, when we were creating the Moxie brand, we had a point to prove to Nigerians. And that is this: that Nigeria and Nigerians can create world-class products. I was speaking to one of my senior colleagues today. She was like, Moxie is in Canada. Moxie is in UK. Moxie, I said, tell them. Because people feel confident taking these products across the border because they know it works. So after 7 years in the Nigerian market, what are our critical stakeholders saying about Moxie? What are the children saying? What are the mothers saying? And what are pharmacists saying? Children love it. Mothers love it. Pharmacists, can you speak for yourselves? Thank you very much. And so, Moxie is that medicine that children love, mothers trust, and pharmacists confidently recommend. But ladies and gentlemen, we are shifting gears now. We've made our point, and Nigeria agrees with us that Moxie is a product that is made here and works wonders. Now we're going global. It's now Moxie to the world. And so, because when we're going to start, we chose a manufacturing partner that was not only local, but was local, which was fully indigenous. Because we wanted to prove that point, that a local company can make world-class products. So we're using Oak Faith, and we are still using Oak Faith. But for the next set of products, we have chosen an international company that has WHO pre-qualification, because now I want to tell the world that Moxie is a brand that can hold its own. So today, ladies and gentlemen, like I said, we're shifting gears and the story continues. We're introducing Moxie Loratadine and moxiclofeniramine manufactured by Swiffer. So Swiffer is our latest manufacturing partner. And the two brands, I should apologize because a number of us are offended with me. They say for 2 years, you have said it's coming, it's coming, it's coming. When is it coming? It has been produced. So the products have been produced. However, the release, we were hoping it would meet this conference, but it's still under the regulatory quarantine period of 7 days after filling. So in the next few days, Moxie should be available with your top wholesalers across the country. And so there's if you scan the QR code or you go to the New Heights stands, like you all know, New Heights is Moxie's national distributor. So if you get to the New Heights stand, you'll be able to scan the QR codes, and you can even pre-order. Because we told ourselves, if you want to buy iPhone, I can pre-order. Why not pre-order Moxie too? And then there are promotional incentives if you pre-order using this QR code or come to the New Heights stand to scan the QR code there. And I would like to close by addressing the big elephant in the room. A number of us have refused to stock Moxie because we say it is too expensive. And we make bold to say that Moxie is not expensive. Moxie is value for money. Our flavors, like I said, come from Europe. The children say, I did not say, the children say that our Moxie vitamin C tastes like orange juice and that our paracetamol tastes like ice cream. And I believe them. Otherwise, they won't be disturbing their mothers for more Moxie all the time. And the new lines we brought in also carry the same things. A CRC cap costs about close to 100 naira for one. The ROPP is about 10 naira. So those differences must be there. Our syringe and everything, those things are expensive just because we want to produce products that we can be proud of anywhere in the world. So as I leave, ladies and gentlemen, I just want to leave you with one message. Moxie is on a mission, and we welcome you to join the Moxie movement. Thank you very much, ladies and gentlemen. You've always been a beautiful audience. Thank you.
Thank you very much, Moxie. Are we going to be patronizing New Heights Pharma? Okay, LB also wants me to tell you that the Diravite Woman Regular and Diravite Woman MC is now available. So as you purchase your Moxie, go to other stores and get the other brands. All right, without further ado, we are going to be moving forward. Now, we are going to be going into zonal dynamics. Is someone excited? Are we ready? Okay. Now, when we say zonal dynamics, you know that the Acpn runs through or it operates through multiple zonal structures. Now, these structures have been put in place to serve as local hubs for all local networking, training, and strategic health initiatives in the community pharmacy space. Meaning, for every zone that you have, we have 4 top zones for today. We have Amen Zone, a round of applause for Amen Zone. We have a Jigbo Zone. We have a Cod Zone. And we have Idea Zone. So for these zones and whatever zone you belong to, do well to participate in your zonal meetings. Know what is expected of you as a zonal member. Okay, so we should do well to pay membership on our zonal dues. We should do well to attend our meetings so that we can get all the necessary information and we can move our profession forward. I will be calling on each zone. They have a total of just 8 minutes. They have a total of 8 minutes to deliver their presentation. Now, timeliness is going to be one of the factors that we're going to look at critically. If you go by your presentation over 1 minute or a second, it will be counted against you. So can we have the assessors together in one place? Can our assessors come together to the front so that they can see properly the presentation that is going to be given at this time? This way, please. Thank you. So I'm going to be calling on Ejigbo Zone to come for their presentation. Please, a round of applause for Ejigbo Zone as they come forward. The representative for Ejigbo Zone, please keep clapping till she gets here. Your zonal members are not here. Oh, I can't hear their voices. That's more like it.
Good morning, esteemed colleagues, dignitaries, fellows of the Pharmaceutical Society of Nigeria, and everyone. I'm Pharmacist Chioma, Zonal Coordinator, Ejigbo Zone. An African proverb says, if you want to go fast, go alone. But if you want to go far, go together. This is our story at Ejigbo Zone. We have united as one family to achieve great things. And this year, our theme or our aim is showcasing our activities for greater impact within the zone and beyond. As we came into the year under review, we had a vision board for which we operated on. We didn't just dabble into the zone. We were intentional about how we wanted our impact to be felt as community pharmacists within Ejigbo Zone and beyond. Our activities that we're showcasing today are grouped under 7 categories, and I'll delve into them as fast as I can, one after the other. Our vision board will be as displayed on the screen. As we moved into the year under review, we're also very intentional about ensuring that we are aligned with all that has been instructed to us by the states. Because we as a zone, and as all zones across Lagos, are an appendage of the states. So we have our goals, our vision board as outlined on the screen. For the year under review, we had several public health campaigns and outreaches, which included the World Malaria Day, World Hypertension Day, which we held in conjunction with the LOMA officers, our environmental sanitation officers around the Ejigbo Zone. We focused on them for the World Hypertension Day. We were able to screen them and offer free medications to them. World Diabetes Day, we also marked that on November 14th. By having free health checks in our individual outreaches. We had health outreach with the Ejigbo Divisional Police Station. We also had welfare outreach with the Destitute Children's Home in celebration of Children's Day, and that was on May 27th. We visited the Destitute Children's Home at Idimu. We continued our advocacy visit to secondary schools. We were able to visit 2 secondary schools to talk to them about drug abuse and also create more awareness on pharmacy as a profession. Then for capacity building for members, our meetings were more than just meetings. We were intentional to ensure that our meetings were strategically planned to empower our members on different areas. In July, we had our Business Evolution Series, which was facilitated by a renowned pharmacist. He just left the stage. Famshino Panubi was with us, and it gave us 21 steps on how to improve our businesses, and most of our businesses never remained the same after that. We also had a seminar on documentation in August. We all know data is the new gold mine, and we're able to empower our members on the reason why they need to take documentation if they wanted their business to move to the next level. In September, we had the Mental Health Matters. We focused on mental health because October was World Mental Health Day. We had that celebrated, but we did a mental health awareness in September, whereby we were able to talk to ourselves in a way as to look at the patients and then on ourselves as pharmacists. In November, we looked at tax matters. Then for collaboration with regulators and local government, we had a pharmacovigilance training by NAFDAC that was facilitated by the PV team from NAFDAC. And we also paid a visit to the executive chairman of Ejigbo local government development area to talk to them about the challenges that we face as pharmacists practicing in that area. For the year under review, we also had zonal inspection and monitoring, whereby we transversed the whole of the zone to be able to see what was going on in terms of the practice space. For members' welfare, we did a lot of improvement on that. Our zonal cooperative is waxing strong, and then our monthly meetings all held as scheduled. The level meetings held, well attended, and we had a growth in our attendance from last year. And this was actually intentional by ensuring that our meetings were not just a talk shop, but an opportunity to improve our practices. And we also did that by intentionally following up our members. I want to thank you very much for our attendance. And I want to thank my ESCO members for all their support and all the members of Ejibo. Thank you so much for your time.
Thank you very much. Okay, moving forward. I saw a lot of dynamics to what they did for this year. I think we should be looking at going to our universities too to catch our young pharmacists while they are still in school. Remember what our speakers talked about, Dr. Margaret Ilumanya. So we should actually try to do what? To start supporting them young. Okay, moving forward. I said we had Amen Zone, Ejibo Zone, ACOT Zone, and Idea Zone. So do we have Ejibo Zone available? Ejibo has done, okay. What about ACOT? Okay, they're ready. A round of applause for her. She comes forward, please. So you have 8 minutes.
Good morning, men of honor. As men of honor, all protocols duly observed. So this is ECOT Zone, formerly known as Ikotu Zone. Ikotu Zone was founded in the year 1995. So this year we are 31 years. So I'll be taking us through the activities we had for the year 2025. So we started our year from February 2025 with our annual general meeting and 30th anniversary. At the 30th anniversary, we honored our past zonal coordinators. We issued them awards. We honored them because they are the reason why we are here today. We honor them for their sacrifices, for putting in the work to bring us this far. And in the month of March, ECOT Zone attended the CEC and Mass. We are always represented. We don't carry last. ECOT Zone. And in the month of April, we had our World Malaria Day at Igondo Markets. We did a general outreach. We did general checkup. We checked for BP. Yes. We checked BP, we checked blood pressure, we checked diabetes for blood sugar, and we also had free eye checkups. We also encouraged and counseled the community on how to keep their environments clean to avoid coming down with malaria too often. We educated the members of the community on where to get genuine medications, so you don't go to charlatans to get your medications, thereby encouraging resistance to anti-malarials. In the month of May, we had a training. We are talking about capacity building because the motto for Acpn says empowering pharmacists to protect the people. So we had capacity building session where our members were trained to be certified in first aid and emergency response. And this was done by a registered agency at one of our zonal meetings. And in the month of June, because we know that our members have been having challenges when it comes to recruitment and staffing. So we had our zonal continuing education where we talked about staffing and recruitment as it involves community pharmacy practice. And we shared a lot of ideas where our members shared ideas on what they have been doing in their private practices that has been working for them. In the month of July, ECOT Zone was ably represented by much of our members at the annual National Conference of Acpn at Anambra State. And in the month of August, Acpn Day of PSN Week, ECOT Zone celebrated in conjunction with other zones at Area M Police Station. We were able to stock their first aid box that had been empty for so long. And we even found out that they had a lot of expired products in their first aid box. So we restocked their first aid box. We had a talk with the police because the police has to be healthy for them to carry out their activities of protecting lives and properties. And while that was going on at Area M Police Station, our subzone, Ikotun subzone and Egbe subzone, had their outreach at Ikotun Police Station. Then Igondo subzone had their outreach at Igondo Police Station. In the month of September, the World Pharmacist Day was celebrated with Acpn Lagos at the new parcel of land acquired by Acpn Lagos. In the month of October, we had PSN task force activity within the zone, and our zonal monitoring team helped in collating the list that was used by the PCN. In the month of November, Acpn ECOT Zone was ably represented at the PSN National Conference in Kano State. Then we wrapped up the year in December by visiting an orphanage within the zone. The orphanage asked for specific medication for their sickle cell warriors. So we gave them cyclavites, we gave them Niclovix, we gave them a lot of foodstuff, and we also gave them a cash gift of 90,000 naira. Then on welfare, we had two of our members. We lost one of our members in the year 2025. We gifted the family of our members with a sum of 300,000. And in that same 2025, we have one of our elders that has been ill for a long time. We visited him multiple times in 2025 with cash gifts and his medical supplies. Then on our cooperative, on our trips, Eco Zone trips, it keeps growing, and now we are 5 million per slot, and very soon we are going to be registered as a cooperative. Thank you for listening.
Thank you very much. Thank you very much. We can see the wonderful things you're doing at your zone. Keep it up. The essence of zonal dynamics is to improve medication access in wherever zone we find ourselves in the community. It is also for us to undertake activities such as what they've projected, World Malaria Day, World Cancer Day, and the likes. So it is very paramount that wherever it is we find ourselves as a zonal member, please give the full support to your zonal executives, and God will bless you in Jesus' name. Say amen. Moving forward, I would now like to call Idea Zone for their presentation. You have 8 minutes.
Good morning, fellows in the house, my fellow colleagues, I greet you all. I bring you greetings from Idea Zone. Idea Zone is made up of Ikeja, Dokpemu, Egbeda, and Akowojo areas of Lagos. And this, what I want to talk about is our zonal activities for the year 2025. Next slide, please. Okay, well, during the year, we usually have our meetings every first Tuesdays of the month. And this meeting, prior to this time, we usually have our cooperative meeting. And it will interest you to know that we have a very formidable cooperative committee that usually sees to the welfare of members. It will also interest you to know that during the last financial year, that our Idea Zonal Cooperative was able to disburse about 15 million naira to its members at a very low interest rate. We usually have the meeting prior an hour before our normal meeting every first Tuesday. And also, during apart from our cooperative that we give out to members, we also give out welfare support. We have for the last financial year, Idea Zone was able to disburse about 2.8 million naira to her members. We see to the welfare of our members marking their birthdays, marking their wedding anniversaries. We will have grandmas and grandpas that have newborns into their families. We saw to them too. We are able to do some voluntary donations to some of our members. We had one of our key members who was seriously down, and as a zone, we're able to rally around him twice last year voluntarily. And Idea Zone did so wonderfully well for the family, and our colleague was very, very happy for the support. The next slide, please. Please, next slide. We had some, okay, these are zonal meetings. Next slide, please. We had some of our welfare beneficiaries. Please, can you go to the next slide? The next slide, please. Next slide. Yes, these are some of our welfare beneficiaries that benefited from our welfare package. The next slide, please. Then we had to help our members to promote their businesses too. We had our capacity building training where we were able to resource key personnel that came to talk to our colleagues, and this actually helped to move their practices forward. The next slide. Idea Zone, we divided the ESCO committee sat and divided the zone into 4 territories, and each territory is being managed or manned by a territorial leader. And what do this territorial leader do? They go and visit members to know what they actually do, not just by training them during the capacity training. They also want to know what they actually do. And after each visit, the territorial leader keeps a note, knowing at least to mark the presence that he or she was actually came around. The next slide, please. We also had Idea Zone actively in state and national activities. We're actually the first zone to raise 1 million naira in ACPN Lagos Cooperative Scheme. We had steady representation at CEC conferences, ACPN, and PSN national conferences. And there was never a time Idea Zone was not well represented. We even had to sponsor some of our members just for them to attend. We have representatives of ESCOs at both the ACPN Lagos State and PSN national. The next slide, please. These are just some of the pictures of some of our members during some of the conferences. Next slide, please. Yes, these are some of our Idea Zone. We have very wonderful personnel, colleagues there. They have received national and state awards. These are some of the pictures of our members who have been recognized at the state level and also at the national level. The next slide, please. Okay, we had outreaches. This is actually one of the outreaches. We marked the World Malaria Day on the 25th of April. This was done at Ikeja Market and at the Ikeja LCDA. The next slide, please. We also had, we wanted to reach to the younger generation. We all know what has actually happened to this generation. We wanted to catch them young. And that was why we were able to mark the International Day Against Drug Abuse. And this was held across different schools in the zone. So each of that slide, please. So each of our members, we divided ourselves into different schools in the zone. The next slide, please. Then we also collaborated with the police to also mark the ACPN Day during the PSN week in 4 different police stations. We divided ourselves into 4 different territories, and we marked the ACPN Day during that week too. The next slide. And with the World Pharmacist Day, we joined other pharmacies to also mark the World Pharmacist Day at the PSN land. The next slide. We also are part of our corporate social responsibility. We partnered with the Nigerian police, and as we can see from the slide here, that the first aid box was actually being provided by Idea Zone. So what we do from time to time, we refill the first aid box from them. So that's part of what our corporate social responsibility. The next slide, please. Then we had a groundbreaking thing that Idea Zone, you guys are wonderful. We had an ACPN land of Idea Zone. While we await the states to give us a go-ahead, we're able to purchase a land under Lagos State, ACPN Lagos State. And we cannot, the next slide, please. Now, we had our end of the year party to tell all of us, well done for a job well done. And this was actually tagged, which was a cultural wear. And we did this, and you can see everybody happy for seeing us through the end of 2025. Thank you very much.
Thank you very much, Idea Zone. Please, I'd like to make an announcement for a Toyota Camry Gray KTU 264GS. Please, you need to repark. KTU 264GS, a Toyota Camry Gray in color. Thank you very much. So, I'm going to be calling on Amen Zone for their presentation. Please, a round of applause for Amen Zone. You'll also be given 8 minutes for your presentation, sir. check it yourself.
Where do I have to press this?
Yeah, it's to save time so that
When we took our oaths at our induction ceremony in pharmacy school, we're not just taking an oath, we're actually obeying a call to serve, a call to protect humanity, and a call to sustain humanity. Good morning, esteemed colleagues, current and past leaders of Acpn, fellows of the profession, merit award winners, distinguished colleagues, and the indefatigable panel of judges. I'm Jagboro Joel by name, and I'm delighted to be making this presentation on behalf of Amen Zone. The year 2025, our activities spread across 3 different areas. First was the area of welfare in terms of developing our members' capacity building, in the area of visitation to our members' premises, and also in the area of giving specific welfare packages to our members in the event of childbirth, marriage, illness, or demise of our members. Secondly was in aligning our programs with that of the state to show how much we are cascading down and trying to fulfill, supporting and achieving the objectives of the state executives and PSN at large. Lastly, on engagement with regulatory bodies like NAFDAC and the police force. The first was our business summit that took place in April 10, 2025. We're privileged to have the highly respected pharmacist Folashade Lawal of Victory Drugs, and we're also privileged to have the highly successful pharmacist Ekene Nwagu of HealthRight Pharmacy, and pharmacist Angela Ohere Odale of Remedial Health. They spoke on emerging opportunities in community pharmacy practice, leveraging on niche creation and technology. Pharmacist Folashade enlightened us about how she was able to carve a niche for herself. And this was very insightful, and members were truly inspired by that. Pharmacist Ekene's presentations was nothing short of an inspiration. He had so much to say. He was talking practically from experience, not about going to the books or talking from the textbooks. Members were really benefited from the summit, and a lot of these insights have been implemented. They even offered mentorship to members. Members have been able to liaise with them after this seminar for one mentorship program or the other. The second was the Panel 17 conference. As we know, the theme was Defy Gravity. Members were inspired on how to go outside and think outside the box in implementing and expanding services offered in their premises. The zone, the fiscal fee for the attendance of that conference was 85,000 naira. There was a general all-pay discount of 20,000 naira. That brought the fee down to about 65,000 naira. So there was also an additional discount for those that attended last year, which was about 10,000 naira. That further brought the fee down to 55,000 naira. And the zone offered an additional discount of 10,000 naira, and Amen Zone members ended up paying 45,000 naira just to attend Panel 17 conference. After that, we have our membership welfare, cooperative loans, and other packages. Amen Zone Cooperative was set up in 2024. Today, we have over 40 cooperators. Contributions today amount to over 5 million naira. 15 members have been empowered through loans, and we've had over 3.6 million disbursed in our loans as of today. Other welfare packages that have been gone out to our members, late from Stanley Agubo received 132,000 naira when he took ill after returning from one of the conferences at Uyo. And this happened months before he passed on, and we are actually currently processing his insurance benefits. Pharmacist Ugede Gaius of Emeyo Pharmacy received 30,000 naira from the zone as support for his wedding in December. Next slide, please. Talking about programs aligning with that of the states, the Acpn day of the PSN week saw us at Okiodo Police Station at Ileku, where we presented a well-equipped first aid kit. We also enlightened the police and its officers about hypertension, its root causes, and the complications. We also went further to enlighten them on how to distinguish between premises of colleagues that are with the correct pharmacy emblem as against premises of unprofessionals and quacks. We also went further in aligning with the state by being present at the World Pharmacist Day. When we were present at the PSN Secretariat, we partook in the march towards the newly purchased Acpn proposed site, and to show our support and solidarity with the state and in everything they are doing at the state level. We have our zonal monitoring team visited over 66 premises from August 2025 to December, identified over 20 illegal premises, forwarded these names to the list, to the state, and we received the national task force that operated in the zone in October. We also identified members that were hoisting fake emblems, and we are advised on the processes to go through to ensure they receive the correct pharmacy emblem. On our engagement with regulatory authorities, what hypertension they found us at Ikeja. We've actually been engaging with the police force since about 2024. In 2024, we were at Menopause Police Station. 2025, May 17, we were at Ikeja Police Station, and we enlightened the police, made them understand that hypertension can be managed successfully, and the reason why they need to go to standard premises that are well designated to receive further pharmaceutical care. Lastly, on our engagement with regulatory authorities, we had our pharmacovigilance session with NAFDAC. And this proved to be interactive when NAFDAC was sharing insights about the med safety app they had come up with, which was to help us to track adverse drug reactions. And this was something that was very impactful. And at the end of the day, we are still looking forward to further interactions. Thank you so much for listening. And as men of honor, let us continue to join us.
Thank you very much, Amen Zone. A round of applause for them again, please. And a round of applause for all the zones here representing each zone they are in here in Lagos. Please put a round of applause for yourself too. You've been coming since on Tuesday, Wednesday, today, Thursday. You've done very well. So I'm going to be calling on CPI for their presentation while we collate the results to know the zone that has won zonal dynamics for CEC 2026. Do you know who has won? You have an idea. Please, a round of applause for CPI as they come forward.
Yes. Listen. Good morning, dear esteemed pharmacists. I would please like to stand on the existing protocols while I wait for our media to quickly do justice to my slide. All right. I want to appreciate the chairman for this opportunity. Something has been ongoing in the community pharmacy session for the last 1 year. And we just want to bring you to that knowledge. So I'm presenting for Acpn National, and I'll be speaking on the topic, the CPI model, building a competence-driven community pharmacy workforce. Over the years, the career progression for community pharmacists has remained undefined. So let me just explain what I mean by this. I have esteemed colleagues, fathers here today, who have been practicing for more than 2 decades. And yet, they are still being referred to today as superintendent pharmacists. At the highest of it all, I was thinking about this yesterday. When we are tired of being a superintendent pharmacist, we eventually upgrade to what we call MD, CEO of the pharmacist. So the lack of career progression for community pharmacists has been something that is desensitizing for community pharmacists in Nigeria. And that is what CPI, Community Pharmacists Assessment and Career Progression Institute, is about to solve. I want to read just quickly from my slide. The career progression scheme for community pharmacists played a crucial role in maintaining a high standard of professional competency and patient care. Just like I highlighted in my opening statement, that is the problem of community pharmacists in Nigeria. The lack of career progression. You start as a community pharmacist, as a superintendent community pharmacist, and 20 years down the lane, you are still being referred to as superintendent pharmacist, or at most, MDCO. So what is the rationale for creating this Community Pharmacist Assessment and Career Progression Institute? I want us to please appreciate our leadership at the Acpn National, who over the past few years, please, if you want to clap, please, you can do that very well. Who in the past few years have been ruminating upon this. How can a community pharmacist be better? How can a professional be motivated? How do we turn a community pharmacist into a profession that is not only meant for pensioners and retirees? Because of this problem, many of the young pharmacists are not actually ready to start their career in community practice. Some of them would like to wait until probably they have exhausted all options and then come to community pharmacy practice. And that is the problem that CPI is to solve. So what is the rationale? To solve this as a community pharmacist, we should be able, with this scheme, we should be able to motivate and reposition us. This scheme will motivate and reposition community pharmacists in Nigeria. It will galvanize the great potential, monitor and support, improve performance and impact, encourage and empower community pharmacists. It will do beyond that. It will also capacitate and standardize the practice of community pharmacists in Nigeria. So, the Community Pharmacist Assessment and Career Progression Institute, although it sounds like an institute, it's not. Somebody have asked and say, is he another institution? No, we are not here to compete with an institution, a existing institution, not even with the West African Postgraduate College of Pharmacy. We are actually to strengthen our practice and to ensure that you are giving the necessary recognition and the standardization that the community pharmacist is required. So it's a pioneering institution dedicated to promoting excellence in community pharmacy practice through evaluate, support, and elevate. These are board members who have been laboring over the past few months to ensure that this project come to fruition. And it will interest us that in September last year, our national chairman took this story all the way to Copenhagen in Denmark to make a presentation of his innovation. And it may interest you that he won a accolade of a global endorsement. The FIP were very excited with what they see, and they actually applauded Nigeria. In fact, they asked us to go back to them, and they said they will actually make a recommendation to other states to see how they can adapt it, in their states and in their country. So this is the national chairman presenting. Please, you can move forward, the crew. You can move forward. This is the national chairman presenting those. What are the objectives for CPI? Develop and implement standardized assessment methodologies, career progression, professional development, and continuous quality improvement. These stand at the heart of our agenda. So what is the rating we are talking about? In the next 3-4 years, you are being referred to as a superintendent pharmacist today. What do we want people to call you in the next 2 years, in the next 3 years, in fact, in the next 1 month or the next few months? So the community pharmacist is structured into 5 bands. The band 1 is community pharmacist. Band 2 is a senior community pharmacist. Band 3 is community pharmacy specialist. And band 4 is community pharmacy senior specialist. 1 by 5, the top. And the peak of them is community pharmacy consultant. So what are the areas we are going to be assessing? Is it just a nomenclature? Is it just a title sake? No. The intention of the institute, as I've stated earlier, is to ensure that we develop our capacity, we standardize our practice, both that we affect not only us as a professional, but we also impart on the community that we are serving. So those are the domains of our assessment: year of practice, advanced qualification, whether you have master, whether you have other skills, whether you have other certificate, research publication, training, mentoring, entrepreneurship, professional attributes, professional practice are some of the areas that we assess. So how does the model work? Number one is to enroll. And if you are here, you are listening to me today, in our place, they say if you hear them say, if you are hearing them say, they are rolling something at the back of your house. They say if you don't join them, they will roll it at the back, they will put it at the back of your house. But our own story is even different, because if we don't join hands to roll this stone, nobody is going to roll it for us. If we don't do this together, if we don't stand and say, no, our profession must change and our practice have to have impact, not only on our community alone, but also be given the due recognition that we deserve. So you have to. So if you are listening to me today, just take your phone, log into www.cpacpi.ng is on that. Just click on that link, type it now, log into that website, and you will see you can just begin your way to your professional advancement at this point. So please click on that link, and then you will see the information that is there. You can start the enrollment. You will see as soon as you enter the website, you will see enroll now. Click on that. It will also bring various things and the document that you can upload. So what you will need to do is just to check the documents. Am I fitted for band 1? Am I fitted for band 2? Am I qualified for band 3, which my year of practice, with this qualification I have now, and with whatever I have in my disposition, what am I qualified for? So you look at that, and then you begin your enrollment. Refill the various criteria. I will go to what is the benefit. I have listened to community pharmacists in this charge of presentation, many of them, and they will ask me, what is in it for me? Is he going to bring more money to my pocket? Is he going to turn things around? Yes, number one is a career advancement. Career advancement, enhanced skills and confidence, professional development, continuous quality improvement, networking opportunities, professional. As a human being, we don't like when people flatter us. But we also appreciate when people give us the due recognition, especially the one that we deserve. Is it not good if I look at one of our father here, pharmacist Ikeja, and I say he's a consultant community pharmacist? How do you think it will feel? Will it be good if I say it's a community pharmacist? Which one do you think will be fine? Or I say a consultant community pharmacist? Which one do you think sound right or sound better? Which one do you think sound more professional? If I say it's a consultant community pharmacist, that is it. Ego is more than ego. You will believe me that many things are more than ego. So professional recognition, improve patient care and outcome, platform for partnership and collaboration, improve professional feasibility and impact, improve health of the populace. For example, if you become a specialist, if you are in band 3, for example, and we say that you are a community pharmacy specialist, what we mean is that you specialize in an area. For example, now, let's look at our secretary here, who we know over the years seems to be specializing in menopause. So if I say it's a community pharmacy that is specialized in menopause, so if I have any menopausal issue and I say, I'm going to refer you to somebody and I know can take care of this. Thank you very much. Please let me put your hand together for her. And then I see a community pharmacist who specializes in diabetes management. Maybe my chairman. And I say, oh, I know pharmacist Tolulope Ajayi. He specializes in diabetes care. I can refer quickly. Those are kind of the things that we are trying to bring up. I'm trying to ramp up now. So those are the benefits that the CPA, CPI will offer us. What are the journey so far? Since the inception of the inauguration of board last year in May, we have been able to attain a lot of change, including the recent stakeholders meeting that was held in Abuja, where we had some stakeholders and some international partners seeing what we are doing and how they can join in and partner with us. The step is to ensure that community pharmacists, as much as possible, hear this story. They appreciate what we are bringing on board, and then they key in to what we are doing. Because, as I said earlier, if we don't roll this together, nobody is going to do that for us. These are pioneer awardees, and then those are the people. These are part of some of our visits we have made and the advocacy we have been making in the last 1 year. Thank you very much. I'm open to any question or any query you may ask. And I want to announce to us that I have with me here in this auditorium, Pharmacist Abiola Egunjobi, who is the Lagos State Licensing Officer. Please, Pharmacist Abiola, please, wherever you are, can you just wave your hand to me? Are you in this hall? He is the State Licensing Officer for Lagos State. So in case of any communication, in case of any inquiry you may want to make, he has all the information. And I believe in very few months' time, it will be going from stone to stone. And I know that my chairman will also support him in providing some of the things necessary, resources he needs to ensure he do this, to present and to get this information across to us. Thank you very much. If you have any question or any query as to the Community Pharmacist Assessment and Career Progression Institute, CPA, CPR, you can ask. Thank you very much. And I want to appreciate my chairman for the opportunity.
Thank you very much, CPA, CPI. Now, before we go into AGM proper,
Hello, good afternoon, distinguished colleagues. Thank you, and I want to congratulate Lagos State for this CEC, for the success. Please, I want to plead with you. I know many of us are like me, that see information on WhatsApp saying, please fill this questionnaire. It won't take you 2 minutes. And what do? We just skip it. Please. This announcement is from Acpn National Research Group. There is a research we are doing on the use of digital tools, the understanding, and whether your clients know how to use it, and whether they know anything about it. Please, the questionnaire won't take you more than 2 minutes. I beg you. A QR code will be shared here. Kindly fill that questionnaire. We're going to put it on the platform too. So if there's anybody here that is not on Acpn National platform or Lagos State platform, please indicate so that we can add you. You are not. Well, I'll come to you. So we can add you to those platforms, please. Please, I beg you, don't be like me. Be better than me. Try and assist us in the research group. Thank you very much, and God bless you.
Thank you very much. So can we be uprising? Yes, please. We need to stretch our body. We are going into AGM. We're going to deliberate and talk plenty. So let's just quickly do the exercise. All right. So we know how to do it. So give allowance to the person on your left. Give allowance to the person on your right. All right. Do we remember? Take it from the top. So we'll know those that were here day before yesterday and yesterday.
One leg in, one leg out. Chippy, you they see me. Change your style, change your style. Okay, be like that.
Let's go again.
Life no be a serious something.
Now tap something. Come on, let's go.
When you wake up for morning, make you thank the Lord. So I say jump, jump. Clap your hands. Mama, 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 yo. This is a love song.
Come on,
for the
clap your
whole
hands.
world to dance and I say jump,
jump, jump.
Clap your hands. Mama, 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 yo. I hope you happy.
Come on, shake your body. Now let's go. Come on. Move out of your space. Come on. Okay, now let's go. I can see her. I'll give her a gift. She's really doing it. Meaning on Monday, on Tuesday, Wednesday, she was really observing. Come on. Bend your knees, twist to the left and right. Come on.
Not only passing where they breathe the chill, not only passing where no seek the
If you can't clap,
even if you chop
go
the
ahead.
healed, even if you never chop the fields, life no be a serious something, still no be a place.
Check your body.
When you wake up for morning, make you thank the Lord.
We thank the Lord.
Say, jump, jump.
Come on,
Clap your
jump,
hands.
jump.
Mama, mama,
Mama, yo.
This is a love song for the whole world to dance.
Come on,
And I
dance.
say, jump, jump. Clap your hands. Mama, mama,
Mama, yo.
I hope you're happy enough to dance. And I say, Jankara.
Move,
Jankara.
Come on.
Jankara. Brother, Maketo Jankara. Jankara.
When you Jankara, you move out of your seat. Come on.
Ijolele dance.
Woo! Bend your knees. Come on. Thank you very much. Clap for yourselves, please. Woo! All right, please, we can settle down now. Okay, we'll be calling our panelists up. Can we have our panelists up here, please? All right, sir.
Do you know their names?
No, I do not. Okay, so we'll be calling up our panelists. Can they come forward, please, so we can start the next session, please? Thank you very much, sir. Please do come forward. Thank you. You're four. So we have just 4 panelists. We have seated already pharmacist Malaria Oregun. He's the panelist for PCN, Acpn, this panel session we're having. The next to come on stage is pharmacist Ikeja FPSN. He's the panelist PCN, Acpn panel session for today. Please a round of applause for him. Joining him already, we have pharmacist Lawrence Ekato, MAW. He's the moderator for this session today. And we have 3 people on here. We're going to be having one more person, the person of pharmacist Ibrahim Babashehu Ahmed. He's a member at FPSN and FPC FAM. He is the PCN registrar. So can we have him up stage, please? Does he have a representative? Okay. So I'll be handing over the mic to our moderator for this session, and we shall go right into it. Thank you very much.
Good morning, colleagues. Okay, yeah, sure. Fellows of the society, elders, merit award winners, we are all welcome to this panel discussion on the relationship between the Pharmacy Council of Nigeria and the Association of Community Pharmacists of Nigeria. Ideally, we should have officials from the Pharmacy Council here. But today, we just got wind of the fact that all the directors were summoned to Abuja. And the appointed representatives of the registrar could, by that, not make it here today. But we'll go on because a communique has to be arrived at this meeting on the concerns of community pharmacists with regards to the regulatory activities of the Pharmacy Council of Nigeria. And that communique will be forwarded to them. And requisite actions will be required from the Pharmacy Council to us. One of the things that we all are aware of is the fact that the Pharmacy Council bill that became an act was officially signed into law by the former president, President Muhammad Buhari, on the 30th of August, 2022, which means in about a few months' time, that law would have been in existence for over 4 years, which also means that that law is already what is in operation in regulating each and every one of us for the past 48 months, or almost 48 months. However, when it comes to community pharmacy practice, one of the things we know, especially in the retail space, is the fact that the retail community pharmacy practice is a sector, is an arm of community pharmacy practice that is supposed to be wholly and fully practiced by licensed pharmacists only. However, we know that that might not be the case. And unfortunately, some of the things we wanted to put forth to the regulators, they are not here. However, as practitioners, it's important that we highlight this fact. And seated here in the panel is, we are looking at the two aspects of community pharmacy practice, which is the wholesale and distribution aspect, which is one of the panelists here is the chairman of the Pharmaceutical Wholesalers and Distributor Association of Nigeria, PWIDAN, and a seasoned community pharmacist practitioner, which the last speaker said we should be addressing as consultant community pharmacists, because he's been in the business and the practice of pharmacy for decades, going to 4 decades, and it is not something that we should take lightly. So we would like to obviously ask some questions. We'll ask some questions. Please, the crew, you have my number, right? You can tell them to forward questions to me via WhatsApp. So we would like to ask questions and from them. So we'll start from there. So we'd like to go to our consultant community pharmacist. Now, when I started with the aspect of community pharmacy, retail community pharmacy practice being practiced only by licensed pharmacists. However, one of the menace of retail community pharmacy practice is what we know as the register and go syndrome. Register and go. For those is there anybody here that doesn't know what register and go is? Hello? Is it safe to assume that we all know what register and go is? R&G. Okay, R&G are not here. Anyway, maybe this program is being beamed online, so they will probably hear. But the issue about R&G, I can see our registrar. Yeah? Okay, the registrar is listening, so we can ask questions. Is the registrar online? Okay. Okay, so he wants to... Yes. Please just a brief interruption. Let's get the registrar online. Good morning to our registrar. Can you hear us? Good afternoon, our registrar. Can you hear us, sir? He can't. Do we go on or can he hear us? He's connected. Okay. I think it's moving now. Good afternoon to our registrar. Hello. Okay, let's go on. So, sir, I wanted to ask that question. In your extensive years of practice as a pharmacist and now a community pharmacy consultant, what is your view when it comes to the issue of register and go? Because, and it's not just in Lagos, it's a nationwide phenomenon. Our young pharmacists believe that my license is separate from my practice. As a matter of fact, they even advertise it. They'll tell you, which one do you want? Is it my license or my presence? So, and that is a recipe for register and go. So in your own view, sir, what do you think is responsible for this, and how do you think we can mitigate, if not eliminate, this issue of register and go?
Thank you, Moderator Law, and thank you, fellow pharmacists. Let me start by disclaiming something first. I'm not a consultant community pharmacist. I'm actually a distinguished consultant, distinguished community pharmacist, and that's an award given to me by Acpn. About consultancy, I have not reviewed. I have not reviewed the qualification to know where I am. The only one that I am certain about is that I'm a superintendent pharmacist, and then I will always remain a superintendent pharmacist. When it comes to regulation, when it comes to PCN, and that is what is important. I'm not saying one cannot grow in career to acquire so many other feathers in your cap. And it takes me directly to the question about R&G. I've had opportunities to speak to young pharmacists during their oath taking, and I didn't call it register and go. I told them I didn't want the members of the public to know about that kind of crime, that pharmacists can commit such a crime like register and go. And yes, we think it's not prevalent, but I think it's becoming more and more prevalent because in so many platforms, you see young pharmacists or pharmacists even advertising the availability of their license for registration, meaning, for instance, that they just want to drop the license, register the place, and do something else. Part of the reason is ignorance of the law. Another one is greed. Another one is, I don't want to say is, well, I do not think they even understand it. They don't understand the implication of using your license to register a premises and not being present and not being knowledgeable about what is being done in a place where you superintend. Because legally, for any pharmacy business to be done there, it is the superintendent that's accountable. And they do it because of greed, because they want money. And then they want the cheap money. Yes, I think it's more common with younger generation. Maybe they have not, or they do not appreciate the kind of trouble they will get into if PCN was to enforce those things. I mean, enforce that law. Because a lot of things could be done in your name. Even if you are present, but you don't understand what is going on in your pharmacy, whenever there's an issue, it is you that will take the blame. Even your managing director will not take the blame, even if it's a pharmacist. You are almost like the chief regulatory officer for your premises, whether it is retail or whether it's even in the industry. So I think many of our people do not understand the law. We have to read it and we have to understand it. And then as a group, we also have to hammer it. It's an offense that you do not have to even think about. If you commit yourself, then stay there and commit yourself, do the work. Many of them are doing it because they are ignorant. Many of the ignorance is also coming because the PCN has not tried to put it down and then sanction pharmacies that are involved in it. And that's why a lot of them are involved in it. Why it is still flourishing is what I do not know. I do not think it will take rocket science to devise using technology how to catch people who are registering premises and not being in those premises. But I think if the PCN needs help, if we ask them and they need help, it will be possible to get a small group to take it as a task to be able to give them a feedback on what could be done. I also think that it is possible for Acpn, even in Lagos State, for instance, using the zonal structure to know premises where they never see the superintendent pharmacist. I hear Ikeja zone, I hear a men's zone, I don't know how many pharmacies are there. I belong to Amuo zone. It should be possible in Amuo zone, if we are 100 pharmacies in the place, to know how many superintendents of those pharmacies attend our meetings, how many we know, and how many we do not know. In fact, I think that in our case, we may even have some where the superintendents are not even in Nigeria in the first place. That's an equivalent of an RNG. Even if you are the owner of the premises, you are not here, we know you are not there, you live somewhere else, and then you don't get another pharmacist to register your premises, it means a lot. But I think it is possible, even at the local level, using the zonal structure, for us to identify those people who engage in that, and then report them in the platforms. And that's where the young people are playing. And that is where we could also appoint champions. You know, sometimes you need a reward to motivate people to catch thieves. And you may even need the thieves to catch other thieves. You open one Telegram platform and one random guy is talking about his license being available for something. What we can just do is to pretend that we don't want to register him. In the next day, we will catch him. Yeah, you may not catch him that he has registered, but you can catch him that he's attempting to register. Even attempting to register should be an offense to PCN, because apart from the law, PCN can also come up with guidelines. Once you attempt, for instance, advertising your certificate for available for register and go, it should be a problem. Young people are prizing their certificates. Well, that one is something that came up in the past 2 or 3 years. Suddenly somebody is saying, pay me 1 million for certificate, pay me 200,000 a year. It is possible to divide the salary of a pharmacist. I'm not saying you can say transport allowance, you can say this, you can say that. It is also possible to have 2 pharmacists working in an organization. They can earn the same salary, but the one who registers can also earn more. And that is where I think the thing is coming. But where also it happens is that some of the young pharmacists will always want some money in bulk. But this is something they learned from registering non-pharmacists. And they want their money in bulk because they are making a commitment in bulk. So it appears, for instance, that we are learning the bad side of the transaction and bringing it to the professional side. Because when they register a trader, they think that they do not have to wait until December to collect their entire money or wait every month. Instead, they want to be paid maybe 1 million or 2 million, and they'll do something with it, even if they work there or they don't work there. But if you come to me and ask me for something like that, I will not be able to do it because I have some leverage. But they also come in different ways. Also, they can tell you they have a problem, they want a loan of 1 million. And for something which they may be entitled to, you give them a loan, it's as good as giving them an advance or part of their salary because they are paying for it. But generally, I think many of us are not knowledgeable about the law, and many of us do not really care. So enforcement should be a big issue. But I think it's beginning to be a big problem with especially the young pharmacists. Sorry, I took a long time to answer.
Thank you very much, sir. There is another aspect of please, you can go ahead and give him a round of applause. That is one side of the spectrum, which is the young people. Fortunately, by virtue of what we do as pharmaceutical inspectors, we see a lot of things. And when you talk about the young pharmacists going into R&G, then there is the other end of the spectrum. The old pharmacists are basically the ones that are registering the non-pharmacists that are into wholesale. So I'm coming to you, sir. How do we advise? Because most of these old pharmacists, they no longer pay for, they are over 40 years. They no longer even pay council for their annual license. Retired pharmacists. Because we see them, and I'm sorry to say, it's so appalling that when you enter some of these non-pharmacist-owned wholesale premises, you see the pharmacist sitting outside of the shop floor, while the pharmacy practice and business is taking place inside the shop floor, and the pharmacist is nowhere to be found. It's almost as good as the pharmacist is the doorkeeper. So what can we do? How do we begin to advise somebody that has been 45 years in the profession as if he's a young pharmacist? Because it's becoming an issue, and that is where most of these illegalities take place. That is where most of the retailing in wholesale pharmacies take place. And the pharmacist in question has no voice, has no say, because maybe he or she is seeking their daily bread. What do you think Pharmacy Council or wholesale, practice can look into this and see what can be done?
Okay, thank you very much. Thank you to the Acpn.
Sorry, sir, a caveat. We know Puidan does not go into this, but it's still within your purview because you want to get all these people into your fold so that they can practice ethically.
Yes. Okay, thank you for this opportunity. I think that as Puidan, we are always looking for opportunities to engage colleagues as well as bring to the fore some of these issues that have been raised. You have only looked at it from just the issue of retired pharmacists, older pharmacists, registering premises, not being a part of what is happening in that premises. But I think the problem is even much more serious than you just analyzed it. Again, we always go back to the fundamentals because we always, as pharmacists, we know that when there's a symptom, there's always a root cause of some of these things happening. And we tend to avoid those root cause issues. As Puidan, one of our advocacy has always been the fact that the government should implement the new drug distribution guideline. And in that new drug distribution guideline, there are lots of things that are there that are able to help prevent a lot of the symptoms that we see. From making sure that whoever is coming into wholesale is actually serious about doing wholesale in terms of the way the businesses are set up and the way the business is run. Because when you set up your wholesale in a way and manner that shows that you are serious about what you are doing, there are certain things that will automatically be sorted out. Okay? The issue of older pharmacists coming in to register formerly retail stores that were compelled to become wholesale by a deal that was struck at some point is where this issue is. And we don't want to talk about it, but it is what it is. Where pressure came from the retail side of our practice that there are some people who own retail pharmacies, but they are not pharmacists. And then there was a deal that was saying that, okay, the only way we can not close down these places, even though it was obvious for this thing to be closed, is to find a way, let us find a way to accommodate them. Okay, we have a problem in retail, let us push the problem to wholesale. And so, collectively, by collective bargain, by a lot of us that are here, we all collectively agreed with the regulators. They were now pushed to the wholesale. Guess what? We simply took the filth that is in our bomb, we simply transferred it into a tissue. But the filth still remains in the tissue. And that is what is manifesting as the symptoms that we are talking about here. Basically, those guys went into the wholesale space, in quote, I use the word quote because they were not structured for wholesale. And naturally, because their primary focus was retail, they were always going to do retail business. And so those are the things that have created like a vicious circle that we have to contend with. And unfortunately, colleagues, whether retired, whether young pharmacists, have now helped to strengthen these structures that these guys have created. So as a way of solving this problem, because we can talk about the problems from now till we all retire, Some of us have started talking about this problem, and some of us are already retiring as we speak. And the issues have remained. We've refused to address the issue, but I think that as a way of solving this problem is for us to collectively insist that the regulatory authorities, in this case PCN, and to a reasonable extent, NAFDAC, should implement the NDDC. There are guidelines there that will help shape a lot of these things that we are talking about. Where they are not present, we can actually infuse them into those guidelines. And by the time this thing is implemented, we will see that we will solve a lot of problems. Truth is, it is very easy for us to sit down here and point fingers. But I can tell every one of us here that every one of us, as men of honors, we are all guilty. In our various practice, there are retailers here who are doing wholesale. They don't have wholesale licenses. And so when you are pointing to the wholesaler that is doing retail and doesn't have a retail license, you are pointing to them. 4 fingers is pointing to you, the retailer, and you know yourselves. If you go to platform, you will see where a retailer is actually selling to other retailers as wholesaler. They are not even hiding it anymore. So we have created, when they say the drug distribution structure is chaotic, we are the number one problem of that chaos. And so we need to tell ourselves truth. And we need to decide whether we want to actually solve this problem or we want to use a cosmetic approach to it. And if we want to use a cosmetic approach to it, then we'll continue to have these conversations all the time. But we all have a role to play. The regulators have their role to play. And we need to call the regulators to play that role. And while the regulators are playing that role, we also need to sanitize our own operations too. We need to begin to do the right thing. And the right thing begins from us aligning with the new drug distribution guidelines that defines different practices and keeps people within the practice framework that has been established. And then we can then begin to insist that the regulators actually, Nigeria is a very interesting country. People do things, they go scot-free. Nobody punishes anybody. And so people begin to do things. First, they do it with fear. Then they go with impunity. And I think that's the situation we find ourselves in, where people do these things they do. They know it is wrong, but they still do it with impunity. Why? Because nobody has lost his license. Nobody has been disciplined by the council. I don't know if the council board has been constituted now. So there are so many issues. This is just a fraction of the real issues that we are talking about. And so we need to call the regulators to do what they need to do. Punish people. Identify people. Especially punish. You see, the older pharmacists may be too difficult to bend, but the younger pharmacists can still be strengthened. If you punish 1 or 2 people, then they will sit up because they will know that this offense is punishable. And they will hopefully adjust. But the other ones, they say a fish is dry. It's difficult to bend it at this point. You break it, the man just retires and doesn't do anything anymore, So, but I think the problem is there. We are all guilty collectively. We must first of all take responsibility for the guilt that we all share and repent. And then begin to say, what can we do to change the narrative? And begin to hold ourselves accountable the same way we are going to hold the regulators accountable. I'll pause for now. Thank you.
Thank you very much. So, we should all repent. Are we all ready to repent and accept the truth? We are not ready. Okay. There were keywords that I didn't use when I was speaking, and I think we can actually summarize the issue about R&G. First, it's an unethical practice, very unethical, and it's even illegal. And I think that it could cost you your license. It doesn't matter whether you are old or young. It could cost you your license for life. It could also cost you a license for like 5 years. I think the PCN should be encouraged to punish people who are caught. And it doesn't matter who the person is. Even if it's Ikeja, please, part of my repentance is that I'll be willing to pay if you find my license somewhere where I am not practicing. I hope the rest of us can also make that personal commitment, because it's not enough to keep pointing fingers like Ochuko said. And I think we may not be unhappy. We may not be very happy with the result of this decision that we're about to take now. First, that R&G is illegal, R&G is unethical, and that Acpn Lagos is encouraging PCN
to stand up and fish out these people who are doing RNG. We are ready to help them do it. And when they are caught, they should just use the full weight of the law to punish those that are found deficient. I hope that resonates with you.
Thank you very much. Another issue that is of global concern, well, let me not say global, local concern in Lagos pharmacy practice is the siting of premises. We all heard the issue that was trending online in Abuja, where a group of people were aggrieved that the Pharmacy Council cited a renowned pharmaceutical chain in a petrol station, in a fuel station. And, like you said, we have laws, but enforcement of these laws has always been the issue. Now, citing of premises, even in Lagos here, a lot of colleagues are always aggrieved when they claim that their premises is less than or is more than 200 meters. And when the regulators come, the regulators tell them it is not up to 200 meters. As a matter of fact, we've seen cases where surveyors, renowned surveyors were used, and they said, according to the surveyor, the distance between the two premises, proposed siting of the premises, is more than 200 meters. But when the regulators on ground use their own, roller to do, which we believe technology can help anyway, but they still do it manually so that all eyes see it. To get the 200 meters location, people are always aggrieved. Colleagues are always aggrieved. Now, what do we think? And this is not just for the panelists. What do we think? Because we need to hear and send a communique. What do we think as pharmacists can be done to alleviate or relieve this issue of 200 meters? Because it's already in the guidelines. It's already there, so we cannot change it. But what do we think we can do to alleviate this issue of siting of two premises within 200 meters? First and foremost, do we all believe that 200 meters is correct? We agree with it. 200 meters between two pharmacies and 400 meters between a pharmacy and a patent medicine vendor. Since we agree, what do we think should be done so that there will be no issues? Because when you sit at the PIC level, you see a lot of issues with 200 meters. A lot of colleagues are aggrieved that their premises was not approved because to them, 200 meters was achieved. But to the regulator, 200 meters was not achieved. So what do we think should be done? What is the suggestion? Maybe from the panelists or from the floor. Maybe we can take, because we don't have any. If the panelists do not have any, say, we can call on the floor, anybody.
Let me take a first step. I see the problem more from the way the distance is measured. If it is specified, 200 meters between this house and this house.
It's actually specified, sir.
No, between this pharmacy and this pharmacy.
Door to door.
But I've seen where they were measuring it door to door. That's correct. I do not see how a surveyor can measure door to door and our inspector can measure door to door and it won't give the same. I do not see how. Because this is exact, unless there's a faulty equipment. So if it is door to door, you have to step out of the door, and then you have to go, and then you have to keep going until you meet the next door. If it is done that way, it should be clear to everyone. that is not up to 200 or that it's more than 200. What may happen is that in some cases, you can get 199, and somebody may want that 199 to be approximated to 200. I'm not an inspector. I don't have any idea. But for things that require measurement and for things that it is very clear, the mode of measurement, where to start, how to go, and where to end, then you will be convinced that it's not up to. And I also suggest, for instance, that if it becomes contentious, then parties that are involved have to be present when the measurement
always
is being,
present, sir.
I mean,
Always.
all of them. Both of them. Then why would there be a dispute?
Let me explain, sir. You want to say something?
Yeah, I want to say something. I think the issues are more my words, your words. We need to take it away from this argument to actual processes that is fully established and very clear to everybody, for everybody to see. So, for example, you talked about the use of technology. There's no reason why I want to drive from here to Ikeja, and I put it on Google Map, and it tells me the distance, it tells me how long it will take me to get there. There's no reason why that simple technology cannot be applied, even in our own spaces. So we need to agree. If it is technology we want to use, let it become universal, let it become uniform. That's one. Two, some of the things that I see from this argument is the fact that the law is bent depending on the individual that is involved. So again, we are not telling ourselves truth. Sorry, I'm going to be saying a lot of truth if I can. If we tell ourselves truth, if we say 200 is 200, and it is applicable to everybody, including Tinubu, including Trump, including Acpn chairman, everybody will align. But where it becomes subjective, that is where it is a real problem. And how we feel about it. How can we manage it? How can we, So if that is the case, and I know those cases, some of those cases are legit in quotes, okay? But we need to now find guidelines that can help to smoothen out those kind of cases where some level of discretions may be required. Again, unfortunately, we have a way of abusing things in this country. So sometimes some things are actually legitimate, as in terms of it can be smoothing out to make it work. But we will now use that as an example to go and outrightly break the law somewhere else. So that is where the problem is. We need to just standardize these things. If we standardize this, a lot of these arguments will be eliminated. Thank you.
Thank you. Sorry. Okay. Yes, you, ma. You were the first to raise your hand.
Good day, men of honor. Good day, women of honor. I said men, you don't answer. You said women, you don't answer. Is it good men? What do I say? Girls of honor. Okay, good afternoon, men of honor. Better. I just want to, number one, please, we are telling ourselves the truth and are washing our dirty linen in public. Some people were saying it, and I want to mention it. If we want to discuss this kind of thing, which I very much agree with, let's warn the media. Let's go offline and warn the media to stay off. If they stay and record it, then we can make money out of them. That's one. Number two is, these things are tied together. Selling wholesale, retail, register and go, blah, 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 200 meters, make the young pharmacists able to sell and survive. If their business will thrive by 200 meters, I agree. Making the hospitals around have their pharmacists, and practicing the way they are supposed to practice, not to have an auxiliary nurse they will train for 3 months, and they will even be dispensing cancer drugs. Because that's why I left Lagos State hospital practice in 1991. When you write down, I should dispense this, and I know there is polypharmacy, it's not going to work. If you send it to the doctor, who is matured and maybe those who practice abroad, they will write you back. I say, I wrote it because of so. Do you have a suggestion? But if you send it to a young boy, those who carry stethoscope around the compound, he will tell you that this is what I do, you must dispense it. And then I don't dispense. And then we quarrel. At the end of the day, somehow it will go either way. And when I was tired, I just left after 5 years. Then bringing it down to sell it because they must survive. You see, go to one estate where I stay. About half a kilometer radius, there are over 10 pharmacies. The only reason why I survive is because 70 to 80% of my prescription is on calls. When I mean on call, somebody gave me your number because I do integrative. I will go to that later. Integrative, and then maybe they have a cancer patient or this or that. Somebody gave me your number. So without that, I don't think I will be able to pay salaries. I don't think I will be able to. So please, let's look at how do the young ones survive. If I close my pharmacy, my children will feed me. But those who feed on it, how do they survive? And still maintain 200.
Thank you. One more, just one more, so that we can move on.
The chairman and colleagues, Pharmacy Totuko has said something very critical about the whole thing. 200 meters, we don't have two different 200 meters. 200 meters is one. So that it's a constant that if you measure and I measure, we will get the same result. Therefore, there shouldn't be any issues. The main issue first, the number one is the pharmacist, who failed to read the guidelines of what are the requirements to operate a retail pharmacy. So he sees the next pharmacy. He didn't care to measure the distance between the pharmacy and where he wants to place his own. He put in an application. There's an issue. He did not meet the requirements. He will claim that he has spent a lot of money. Even some will have made the whole thing, including shelves. So it becomes emotional, and then he wants, by all means, the premises to go. So, in essence, as pharmacists, let us take our time to know what is the requirement before we pay for a location for pharmacy. That is one. Two, come back to what you said about who is who. The person who believes that he's going to be favored, he cares less of what the law says and the requirement. And he feels that when he pays and he put application, then he must find his way by all means. And therefore, it's either the leader in the regulatory body is being intimidated, and then there's a problem of consideration and sub-pedaling. Those are issues. If all of us agree 200 meters is 200 meters, we would not have any place everybody will be. 200 meters, he says, is radial. That is, if I stay here, 200 meters away from here, 200 meters away from here.
The registrar could not connect. He tried severally on the former link we shared with him. As I speak, he's still trying. We have to send him another link. Obviously, the network where he is not good enough. But if he succeeds in joining, we'll be able to accommodate him at any point in our proceedings. So before we proceed into the AGM, we'd like to quickly give out some awards. Like I told us at the beginning of the conference, this is more like conference of awards, conference of recognitions. We had a few on our day one and some yesterday, and we still have a few to give before we proceed into the AGM. Quickly, I will be starting with the panel, the panelists at the just concluded session. So quickly, we'd like to have pharmacist Ogene Ochuko Omaruaye, popularly known as Mr. O. We know quite well we didn't have enough time to engage, but I'm sure I have the consent of the House that in no distant time, we won't wait till CEC 2027 before we engage CEC again. Before we engage PCN again on this all-important issue, because there are still a lot of burning things that people want to
voice out. But what I'll say is all those issues, please, let's feel free. You can send to me, or we'll also share a number where we can send them to. We'll compile all of them so that when next an opportunity shows up, we will, have them handy to present. So to present this award to our dear brother, friend, colleague, bigger player in the industry, I hope all of us are patronizing him. It's the pride of wholesale pharmacy, not only in Lagos, but also in Nigeria. I'd like to call on our one and only Geo pharmacist, Benga Olubowale FPSN, to help us present this well-deserved award on behalf of the association.
Well, I don't know what the chairman have up his sleeves, so I'll come here for this assignment. But possibly the spirit minister to you, because this is a special award. I'm so delighted to be handing over to no other person than a bosom friend way back. And one person that we are also proud of in the industry, who is showing us how things should be done. And if you are looking for a role model or mentors, these are good models that we can copy. So on behalf of Acpn Lagos, this is an appreciation award presented to pharmacist Ogene Ochuko Omaruaye, a fellow of the Pharmaceutical Society of Nigeria, panelist at Acpn Lagos 2026 Continuing Education Conference, held on the 24th to 26th March 2025, duly signed by the Lagos State Chairman, Acpn, Pharmacist Oluwape Ajayi, and well endorsed by all Acpn members. So, Pharmacist Ochuko, we are very proud of you. Please keep making us proud and continue doing things that we can showcase to the world that truly best practice is obtainable in this climate if you so desire. Thank you and congratulations.
All right, and next awardee is a distinguished community pharmacist who has refused to be called a consultant. We'll find a way around it. Pharmacist Sir Ike Ogu, the Managing Director, CEO, PharmaCare Nigeria Limited. Please join me to appreciate him as he comes up for his award.
Once again, I'm most delighted to give this special award, an appreciation award on behalf of the Acpn Lagos State, to a man of many parts. When he was speaking, which we all know that as practitioners, we always wear two caps. That's the business cap and the practice cap. But then this super mentor was not ashamed to tell us that, look, the bottom line is where everything lies. Because as practitioners, if you cannot, adjust it in such a way that everything matches up, you'll be out of business. And there's something they keep saying in pharmacy that I've been hearing for over 40 years. That as you get old in pharmacy, you get poorer. But these are men who are getting old. They are not getting poorer. They are getting bigger. So please, if you want to grow up, start thinking of growing up to become like people like Pharmacist Ikugu. Have I spoken well, sir?
I have no comments.
So once again, on behalf of Acpn Lagos State, This is an appreciation award to pharmacist Sir Hike Ugu, FPSN, as a panelist at ACPN Lagos 2026 Continuing Education Conference, duly signed by our chairman, Pharmacist Olope Ajayi, and fully endorsed by all members of ACPN Lagos State. Thank you so much, sir.
And thank you, sir. Congratulations. And last but not the least, we'll have the moderator of a session. Where is he? Is a director of our, is my immediate past chairman, is the one that pulled me into the mission at hand. And I've told him that anywhere he goes, I will follow him and let people know that he's the one that drew me into. So please join me to appreciate the immediate past chairman, Pharmacist Lawrence Ekato, who moderated the PCN ACPN session.
Mr. Moderator.
Yes, sir.
On behalf of ACPN Lagos,
Up, ups. Up, ups.
this is an appreciation award presented to Pharmacist Lawrence Ekato, Merit Award winner, the immediate past chairman of Lagos State ACPN, as the moderator of the very last session we had, which was quite scintillating and very interesting. This award is duly signed by the ACPN Lagos State Chairman, Pharmacist Olope Ajayi, and also well endorsed by all of us here seated. Well done, Mr. Moderator. My job is on.
Thank you, sir. Thank you, sir. All right, for the next set of awards, I'd like to call on one and only ABO, Pharmacist Anthony Bola Oyawole, FPSN, to help us with the next set of awards. Just 3 of them, very amiable people. I usually say this, that it's one thing to have a vision. It's one thing to announce it that you want to do it, for leadership to speak. It's another thing for the members to buy into it. It's one thing for members to buy into it. It's another thing for them to add action, not just by word of mouth, but, to throw their weight behind you and, get it executed. So few months ago, the association talked about acquiring a parcel of land in Lagos. And when we announced it, it was actually very intimidating, and many people felt it won't be achievable, not even in the next 10 years. But some people just believe that, yes, it is time, and it can be done. And they kept on encouraging. They kept following everywhere we went for negotiations and all that. Even when there was nothing to... Eventually, to cut the long story short, it's a reality today that ACPN Lagos has a parcel of land in a prime place in Lagos State. So join me to welcome up stage the chairman of the Building and Project Committee of ACPN Lagos for his award as the... Where is it? Pharmacist Isaac Olufuminiyi, chairman of the Building and Project Committee of ACPN Lagos. So incidentally, we named this award the Working Committee of the Year Award. We have 6 committees, and this committee actually stands out. It's the Building and Project Committee of ACPN Lagos. Thank you, sir.
Wonderful. Pharmacist Olufuminiyi. Well, on behalf of ACPN Lagos, whom you are a member, a serving officer, and I know you are also a servant of the Most High God. I think you didn't believe only that prosperity is only in the heavens, but also in this world. And you, as the chairman of the building committee, as said by the chairman, found it worthy that these executives have to leave their footprints on the sands of time. And there is no better way to do it than to have a legacy that will live for generations. And you have started that by making sure that Acpn is not just waxing stronger in terms of practice, but in terms of legacy and making itself a strong family in Lagos by putting its own roots down. So on behalf of the ESCO, led by our distinguished chairman, performing chairman, a chairman that has brought new things to happen to Acpn, I have the singular honor of presenting to you this award to the Building and Project Committee of Acpn for living up to expectation of having a good legacy for the association. This 2026 CEC Continuing Education. Congratulations.
Thank you, sir. I would like to confirm if Chukwudi Ezewane is in the house. Where are you? Chukwudi Ezewane, where are you? If he's walking outside, please let's beckon on him. He has an award here. Pharmacist Bone Ilukwe. Pharmacist Bone Ilukwe. She's among the 3 people that I said stood strongly with us, that didn't allow us to be afraid when we were busy looking out for a place to acquire in Lagos State. We appreciate you, ma. She didn't allow her age, gently, her schedule to do stuff.
Wonderful. When the chairman, when you were talking, you were saying that she didn't allow her age. Is it her age or his age? Do we have, as she's a man now,
yes, sir.
As men of honor, we join hands. And she's living up to the metro now. So yes, I know the class of what she can do. And she's living up to that expectation. So I'm not surprised. So this Visionary Leadership Award is being presented to you on behalf of the Acpn Lagos for your continued support and also identifying with good legacy for Acpn Lagos. We congratulate you, and we believe that to whom much is given, much is expected. In as much as we have sown the seed now, that seed must germinate to a gigantic structure, and I know you are going to be part of it. So congratulations.
Thank you, man. Thank you very much, sir. So I'd like to call on pharmacist Aminu Abdusalam. Yes, sir. Our Encyclopedia of Pharmacy Laws to help us with the next award. Is Fam Chukwudi in the house, or he has gone to bring money? Okay, maybe somebody will take this on his behalf. Any friend of Fam Chukwudi in the house? Any exco that can receive this on his behalf? Pharmacist Chukwudi Ezewane. Is he around? All right, please, let's have someone receive this on his behalf. Is the second person that stuck out his neck. You know, there are times people will be scared to enter into an agenda. Okay, what if it doesn't work? Won't I burn my fingers and all that? But they stuck out their neck and joined us in the risky venture and made it happen. Over to you, sir.
On behalf of the Zonal Community Pharmacists of Nigeria, Lagos State, Farm Chukudi Ezenwani has been found worthy of giving this award. The award, it looks small, but it carries a very big message. And therefore, we believe that this type of encouragement will stimulate his further commitment to responsibility of Zonal Community Pharmacists of Nigeria. So on this day, 2026 Continuing Education Conference, 2024 to March 2026, in 24 to 26 of March 2026, in recognition of your commitment to project execution of Acpn. We believe that this will make you to work stronger, and the commitment is just the beginning. We are also going to work together to make sure it's finally accomplished. So congratulations.
Thank you, sir.
Thank you, sir. Don't forget, sir. So the last award in this segment goes to Pharmacist Isaac Olufuminiyi, this time around for what he also did in relation to the project that we just did. The first one is for his chairmanship position for the best working committee, which incidentally happens to be the building committee. And then this is for what he personally did, not as a chairman of the committee, but because he believed in the vision and he threw his weight behind it. Over to you, sir.
Yes, Pharmacist Isaac Olufuminiyi, where's your wheelbarrow? I'm going to carry all these awards. On behalf of the Zonal Community Pharmacists of Nigeria, Lagos State Branch, Pharmacist Isaac Olufuminiyi has been found worthy. Pharmacist Isaac is the MD, the Managing Director of the Omega Pharmacy Limited. Found use on the 2026 Continuing Education Conference that held between 24 and 26 March 2006 in recognition of your commitment to the project execution. Your commitment has not stopped. I believe we'll continue to nurture the commitment. At the end of the day, our project will be accomplished. Congratulations.
Sir. Thank you, sir.
Thank you very much.
Thank you, sir.
And a round of applause for all the awardees. A round of applause for them. They are truly men deserving of honor. We shall be progressing into our AGM, but before we go further, just like we were advised, we are sharing cars for non-pharmacists outside. So if you are not a pharmacist, just go out and pick the model of car that you want. If it's 2022, 2025, or 2026, Acpn is giving cars. So through that exit way, please find your way through that corner. If you're not a pharmacist and you're still seated, the cars will be done with in 5 minutes. So please progress to the end of the hall so that the pharmacists can progress into the AGM. Thank you very much.
Let's appreciate our MC, wonderful MC. Thank you, Pharmacist Grace. And that brings us to the close of CEC 2026. And by the special grace of God, 2027 will be one notch higher again, by the special grace of God. So we'll quickly move into AGM, and everything will be very, very swift and business-like. So I'd like to quickly call on Pharmacist Nikoro, FPSN, to give us the opening prayer as we start the AGM.